All right. Good morning, everyone. It's a bit early, a couple of weeks before classes begin, but welcome to the second workshop on prediction of phenotypes using genomic data. This was a workshop that was initiated last year under the leadership of Patricio Munoz and Marcio Rezende. We realized that there was a lot more interest than perhaps we had anticipated, so we decided that there was a good reason to actually continue this over the next few years. This is actually now, part of this workshop is actually funded through a USDA grant. So again, we're very thankful to the USDA for supporting this event. Now, part of the rationale for why we created this workshop in the first place was because we realized that there's a number of researchers in different fields in human genetics, animal breeding, and plant breeding that are really adopting these technologies, especially these genomic technologies, to predict phenotypes. But to a certain sense, the questions that they're asking are somewhat different sometimes, and a lot of them perhaps are using somewhat different strategies. So the idea behind this workshop is really to bring together people in these different fields of animal, human, and plant genetics to really discuss and really present the latest data on phenotype prediction using genomic data. I will leave this now to Dr. Concannon for some opening remarks. And I've been told we have to use two mics, so the transfer of powers will be a little bit more difficult than usual. So there you go.
I'll just set them on the camera.
There you
go. Okay, well, with this kind of odd microphone thing, this will prompt me to make my comments brief. I'd like to welcome everybody to the prediction workshop, the second annual prediction workshop, not only the people here, but the 500 some odd people who registered to get it streamed online. I think there's more than 60 countries represented, so that's really very nice. At the Genetics Institute, we're really happy to kind of sponsor and host this workshop because it really typifies the kinds of things we do, applying genetic tools across disciplinary boundaries, and today we're going to hear about medical applications, agricultural applications, and even within agriculture, a number of different systems that are going to be looked at. So I'm looking very much forward to hearing the talks today. I'd like to acknowledge the contributions of a number of people. Obviously, organizing committee, Patricio, Marcio, Matthias Kirst. Our speakers, who will be introduced individually to you before their talks. Some of the Genetics Institute staff have been working very hard behind the scenes to get the speakers here and get the infrastructure in place. And the sponsors, of course, all of whom are indicated here, so I don't have to recite them from memory, and maybe I could, and you could test me on them, but they're all right here. And finally, all of you for attending and for your participation in the workshop. Thank you, and I hope it goes well.
Okay, all right. Do you want to pull up her presentation? Right, so our first speaker today is going to be Dr. Larissa Cavallari. Larissa has joined UF relatively recently, I think in April of this year. She has a pharmacy degree, a PhD degree from the University of Georgia. From there on, she went to do her residency training at the VA in Memphis, Tennessee, and then she actually came back. She actually came to UF for the first time for a fellowship, working in the cardiovascular pharmacogenomics here at the university. Then she went to Chicago to the University of Illinois for a little while, and then finally she came back to UF, and she now serves as the director of the personalized medicine program. She also is the director of the Center of Pharmacogenomics, and she is an associate professor also here at the university. Again, this is the first talk of this meeting today, of this workshop, is heavily geared towards pharmacogenomics, towards the use of genomic information for personalized medicine. Thank you, Larissa, for... Yeah, and just a quick note for the people on the live streaming, you can ask questions directly using the online system, okay? All right.
so hopefully this works okay. So thank you so much to the organizers for inviting me here to speak today. And so I'll specifically be talking about warfarin pharmacogenetics. And so the phenotype that I'm talking about is the warfarin dose requirement. So are you familiar with warfarin or Coumadin? It's another brand name. It was previously referred to as rat poison because it was initially marketed as a pesticide. So it's an anticoagulant agent that's actually the most common oral anticoagulant that is marketed in the U.S. and other countries. And it's a very difficult drug to manage for a number of reasons that we'll go over. And so the dose that a person needs for optimal effects of the drug is highly variable. And so the phenotype we're going to talk about is the dose that they need and how genetics is predictive of that. And so my specific objectives are, I'll actually start by just reviewing a little bit about the history of pharmacogenetics in general and the progress, particularly in recent years, of applying genetic data to predict drug response. And then I'll shift to focus more on warfarin. And when I was previously at the University of Illinois at Chicago, my research focused on warfarin, predominantly with identifying variants that were important for minority populations. We had a very large minority patient population group there. We also developed a warfarin pharmacogenetics service. It was one of the first in the country where we made it standard of care, where we were dosing patients based on genotype and clinical factors. So I'll talk a little bit about that and the challenges that we encountered. So as a little bit of background, in order to understand where pharmacogenetics fits in, we have to really appreciate what are the limitations of our current approach to pharmacotherapy. So currently, if we have a population with disease, we generally will institute very similar therapy for all patients, mostly based on what the guidelines tell us. And so in large clinical trials, a particular drug therapy may have overall in the population shown to be a benefit, so this is what we'll use. But of course, there were outliers in those trials, some of whom did not respond to the drug and some who developed toxic effects. And this is what we see in clinical practice. So if we use the same therapy for all, the majority of people will respond well and tolerate the drug okay, but we'll have the subset that will get no response to the medication that we choose. It'll be ineffective. Their disease will continue to be unmanaged, and so they're at risk for worse sequelae. And then we'll also have this group that will have intolerant adverse effects. They could just be troublesome adverse effects that affect adherence to the drug, or they could be really serious and even life-threatening adverse effects. And the problem is that it's very difficult right now to tell into which of these categories a person is going to fall. And so we mostly use this trial and error approach to drug prescribing, where we try a drug, see how it works, and then we go from there. So we know there's a lot of factors that affect drug response. These include clinical factors, demographic factors like age, body size, kidney and liver function. And then for some drugs, even alcohol use and diet can be important. And then we're always cognizant about drug interactions. And it's now become more and more well recognized that genetics is a major factor that influences drug response. It can influence the disposition of the drug in the body, so how much is absorbed, how much is available at the site of action, as well as the sensitivity of the body to the drug. Oops. So pharmacogenetics, if you look up the textbook definition, it's defined as the hereditary basis for inter-individual differences in drug response. So to explain why patients respond differently to medications. You'll hear the terms pharmacogenetics and pharmacogenomics, and they're used interchangeably. I've probably already used them interchangeably and will continue to do so during this talk. In general, pharmacogenetics refers to a limited number of genes that affect drug response, whereas pharmacogenomics is a more genome-wide approach. There are several promises of pharmacogenetics. It promises to improve our use of existing therapies by increasing the drug effectiveness and improving the safety of medications. And so, for example, if you're familiar with clopidogrel, it's also called Plavix. There are a lot of Plavix commercials on TV now. And if you listen to those commercials, it'll actually say that if you have a certain genotype, this drug may not work for you. So we can actually genotype patients for, it's actually in this case, it's the cytochrome P450 2C19 gene to help predict whether they will respond to clopidogrel or not. And so clopidogrel is very commonly prescribed to patients who have had an acute coronary syndrome, heart attack, and they often will undergo angioplasty afterwards and have a coronary stent that's placed. And so Plavix is prescribed to prevent this a clot from forming in that stent and causing catastrophic consequences, as well as to prevent another heart attack or another acute coronary syndrome. And so if you have a certain genotype, the drug will not work. And so actually at the University of Florida, it's now the standard of care that for every patient who goes to the cath lab and gets a stent placed, undergoes angioplasty and has a stent, we genotype them for this cytochrome P450 2C19 variant to determine whether or not clopidogrel will be effective in those patients. And for those who have a genotype suggesting it's not effective, then we have the therapy altered to a more effective medication. Something else that we're currently doing at the University of Florida is we're genotyping to determine dose requirements for mercaptopurine. This is a drug that's commonly used for children who have acute lymphoblastic leukemia. And it's a very toxic drug, as most cancer drugs are. And if you have a certain variant in a gene called thiopurine S-methyltransferase, then you're super sensitive to this drug and at very high risk for adverse drug effects. And in fact, these effects can be life-threatening to children who have a certain genetic defect and are given normal doses of the drug. And so we now genotype children who will need this drug to help determine the dose that they'll need so that we can provide more safer therapy. Pharmacogenetics also promises to inform the development of novel therapies, and probably one of the ones that's most well recognized and one of the first examples is trastuzumab, or Herceptin. This is a drug used for breast cancer, particularly for women who have a very severe form of the disease that's associated with a very poor prognosis. And in these women, if they overexpress this certain protein, which is referred to as HER2, or human epidermal growth factor protein, then this portends a very poor prognosis. And so based on that, this drug was developed and it actually works against that protein or antagonizes it. So before women can get this drug, they have to be tested to determine whether they overexpress the gene or the protein for HER2 to determine whether they'll respond to this drug. So we've heard a lot about pharmacogenetics in recent years, but it's not a new area. And in fact, one of the first examples in the literature was back in the 1950s when they found that individuals who had an inherited deficiency of this glucose 6-phosphate dehydrogenase were at increased risk for serious hemolytic reactions to an antimalarial drug called Primaquine. So way back in the 1950s is some of the earliest examples. And then in 1957, there was an investigator, Arno Matulski, and he actually stated that inheritance might explain many individual differences in the efficacy of drugs and the occurrence of adverse drug effects. So this is really the definition that we use for pharmacogenetics today, and it was defined way back in 1957. And then the term pharmacogenetics first appeared in the literature in the late 1950s, and so again, not a new term. And then we've seen a really resurgence of interest largely because of the Human Genome Project, which began, of course, in 1990 with completion of the project in 2003. And so at the time that the Human Genome Project was completed, they asked Francis Collins, who directed the Human Genome Research Project and is the current director of the NIH, to opine on the future vision of medicine. And so we said, we'll still get sick, we will still need drugs, but these will be tailored to our individual needs. And so we are actually here today where we are using genetic information to try to tailor drug therapy to an individual patient. So the FDA has invested a lot in making pharmacogenetics a reality, and one of the most visible actions that they have is they approve genetic information in drug labels. And to date, there's over 120 medications that have genetic information in their FDA-approved label. In some cases, this is just information only, but in others, it's actually may appear in a boxed warning to warn the clinician based on a certain genotype, the patient may either have a risk for adverse effects or may not respond to a particular drug. These are some of the medications with genetic labeling. You can see they include drugs for in psychiatric field, neurology field, cardiovascular, and of course cancer field. So they really span all disease states. One of the big barriers to actually using genetic information to choose drug therapy is that there's felt to be this lack of guidance on how to translate this genetic information into actionable prescribing decisions. So how do we use this genetic information? And so the NIH supports the Clinical Pharmacogenetics Implementation Consortium, or CPIC. This was formed in 2009. It's a shared effort of the Pharmacogenomics Research Network and the Pharmacogenomics Knowledge Base, and it's designed really to address this barrier. So they provide guidelines for the gene-drug pairs for which there is the most evidence, and these guidelines specifically help clinicians understand how to use available genetic information in drug therapy. So they don't say whether or not to test patients for certain genotypes, but if you have this information, how to use it. And we're finding that more and more of our patients actually come to the doctor with genetic information. They may get this through commercial companies such as 23andMe or things like that. Have any of you done 23andMe? I see some nods. And so people can get their genetic information and bring this to the physician, and so it's important that the physician know how to act on this sort of information and which information is important, and then on the other hand, which may not be so important and shouldn't be acted on. There are CPIC guidelines for over 13 drugs or drug pairs to date. This is just sort of to give you an idea of what those particular guidelines are. They first were published in 2011, and then they make an effort to update these on approximately every 2 years as new evidence emerges. And so we're going to talk about warfarin today, which is the third one that was published, and we're actually working on an update to these guidelines now. All of these are freely available through the Pharmacogenomics Knowledge Base, and this is the website. It's pharmgkb.org. It's really the premier site for pharmacogenetic information. And so what they do is they curate this information and then they summarize it in a manner that is useful for both clinicians and researchers. And so you can click under CPIC gene drug pairs here, and then there also may be a link up here. It will take you to a source where you can directly download the guideline. So I want to focus now on warfarin, or Coumadin, and in reference to one of my co-speakers from Wisconsin, the WARF part actually stands for Wisconsin Alumni Research Foundation, and this is because it was the University of Wisconsin that actually discovered the active chemical in warfarin that was responsible for its effects. If you want to look at the history of warfarin, it's actually really interesting. It involves cows and spoiled sweet clover, and these cows getting hemolytic reactions, and then they discovered what was causing that was this chemical in the sweet clover, and that was a derivative of dicoumarin, which is where the arin comes from. So the brand name is Coumadin, and this is just to show you the CPIC guidelines, and here's a reference to those. Coumadin, it's a tablet. It's very commonly prescribed, the most common oral anticoagulant. It's used to treat and prevent blood clots, so deep vein thrombosis, clots in the legs, pulmonary embolism, clots in the lungs, which can be fatal. Patients who have atrial fibrillation, heart arrhythmias, or a mechanical heart valve take Coumadin to help prevent a stroke from occurring, a clot going to the brain. There are some newer agents that are available now. But Coumadin still remains the most commonly prescribed oral anticoagulant worldwide. It's a very dangerous drug to manage. It's actually the leading drug-related cause of hospitalizations among older people. The risk for Coumadin is mostly bleeding, and so there is a box warning on the FDA-approved label stating about the risk for bleeding. When we dose warfarin, we measure a blood level. You can do it with a finger stick test. And it's a level, it's called an INR, or International Normalized Ratio. I'm just going to call it INR. It's basically just a measure of how well warfarin is keeping the blood from clotting. For most people, we want this INR between 2 and 3. It's a very narrow range. This is a narrow therapeutic index drug. And if the level goes above 3, there's a significant increased risk for bleeding. And if it's below 2, there's an increased risk for clotting. So patients who are on this drug have to come back to the doctor routinely, like every month, or now they can go a little bit longer than that, to get their blood checked to make sure this level stays between 2 and 3. So as I mentioned before, the dose that a person needs to get this INR in the right range so that they get this optimal anticoagulant effect without having an increased bleeding risk is very variable. These are data from over 5,000 people around the world who are on warfarin. Most had an INR of 2 to 3, and this shows the dose they needed in milligrams per week. So some people may need 15 or less milligrams of warfarin a week to have an INR of 2 to 3 for the drug to work well in them without them being an increased risk for bleeding. And others may need 60, 70, or even more milligrams per week. So there's huge variability. And it's really difficult when we start a patient on this drug to know what dose they're going to need. I mean, it's virtually impossible. And so to show that a little bit further, when I was at University of Illinois, I actually worked as a pharmacist in the Coumadin clinic. So Coumadin or warfarin is one of the few drugs that has its own clinic to manage it because it's such a difficult drug to manage. And this is where we do the INR checks and we'll adjust the dose if need be. So these are 2 patients in our clinic. And both of these patients, you can see they have very similar demographic and clinical characteristics. They're both African American men, similar age, similar body size, normal liver function. The drug is almost completely metabolized by the liver. No interacting medications. They both consume very low amounts of vitamin K. Vitamin K antagonizes warfarin, so actually if someone is bleeding, is overdosing, we give them vitamin K to work against this. But if they eat a lot of vitamin K in their diet, like spinach, broccoli, kale, things like that, then this can actually antagonize the effects. So these 2 patients, they look very similar as far as demographic and clinical characteristics, and if they came into the clinic and you knew they needed warfarin, you would predict they probably need a very similar dose, but they don't. Patient A actually needs just 3 milligrams a day, so this is milligrams per day. The last slide was milligrams per week, so that's the difference. So 3 milligrams per day to get an INR of 2 to 3, and the other needs 2.5 times that, and you would not be able to predict this. We enrolled these people in one of our studies and we genotyped them and found that patient A had the genotype for decreased metabolism of warfarin and increased sensitivity to the drug. The other patient had the genotype for extensive metabolism and decreased sensitivity. So in this case, the genotype completely explains the dose difference that these patients need. This slide shows the major genes that are involved with determining warfarin response. There's cytochrome P450-2C9, which metabolizes the more potent S enantiomer of warfarin to an inactive form, and VCORC1, which stands for vitamin K oxidoreductase complex 1. This is the target protein of warfarin, so warfarin inhibits VCOR. This prevents reduction of this vitamin K epoxide to a reduced form that's needed to activate clotting factors. So there have been a number of researchers, probably hundreds of publications, where they have looked at the association between genotype and warfarin dose requirements, and they're highly consistent. And these are 2 of the studies, 2 of the original studies, but pretty much all the studies look like this. So both of these were done in Europeans, and in this first study, they looked at the effect of the CYP2C9 gene on warfarin dose requirements. This shows the dose requirements in milligrams per day, and these are the different genotypes. So the major variants in Caucasian populations are the star 2 and star 3 variant. These are associated with reduced CYP2C9 activity. And what you can see is that individuals who have a star 2 or star 3 need a much lower dose of warfarin to get the INR between 2 and 3 to get for ideal dosing. So 5 milligrams per day in those who have normal metabolism can be as low as 1.5 milligrams per day in those who are homozygous for the variant star 3 allele. So current guidelines say that you should start patients on a 10 milligram loading dose, unless they're at really increased risk for bleeding, in which case you would start at 5 milligrams. And then you would continue 5 milligrams until the INR is available to help guide further dosing. So if you start a patient with a star 3 genotype on 5 milligrams a day, what do you think is going to happen? They're going to quickly get supratherapeutic and be at increased risk for bleeding. And these variants are associated with an increased risk for major and life-threatening bleeding. The other major gene is VCOR. There's a single variant in the promoter region of the gene that affects the expression of the gene. So there's increased expression with the G allele and decreased with the A allele. Here, individuals who are homozygous for the variant AA genotype, then they need only about 2.5 milligrams of warfarin a day. Heterozygotes about 5 milligrams, and then those with the least sensitive genotype need about 6 milligrams per day. This gene explains a lot of the differences between ethnic groups on the amount of warfarin that they need. Most Europeans actually have the heterozygous genotype. Most Europeans are AGs, about 50%. And the others it's sort of a split between the AA and AG genotypes. And so this explains why in Europeans, most of them need 5 milligrams a day. And this is sort of why our guidelines say use 5 milligrams a day, because most of the data are available from European populations. In Asians, about 90% have the AA genotype, which explains why most of our Asians need a low dose. And then most of our African Americans, about 75%, have the GG genotype, which explains why they need a higher dose. But again, African Americans, only 75% are GG, so some may be AA and some may be AG, and they need a lower dose. So you can't assume that just based on ethnicity, this is the genotype a patient will have. This shows the various alleles for CYP2C9. We talked about STAR2 and STAR3. These are non-synonymous SNPs in the coding region of the gene. About 30 to 35% of Caucasians have one of these and would need a lower dose of warfarin. In contrast, only about 6% of African Americans have a STAR2 or STAR3 variant. The 5, 6, 8, and 11 variants occur almost exclusively in African Americans. Have here less than 1% of whites, and this is the allele prevalence, have less than 1%, or actually not even the allele prevalence, it's the prevalence of Caucasians or African Americans that carry one of these alleles. So here I have less than 1%. It might as well be 0% because these don't occur in other populations besides African Americans. These are also non-synonymous SNPs. STAR6 is actually a nucleotide deletion in coding regions of the gene. They all lead to reductions in enzyme activity, decreased clearance of warfarin, and needing a lower dose requirement. And what you can see is that the STAR8 in particular, about 12% of African Americans have this, which is twice as many as STAR2 and STAR3, which is what we'll see appears in all the guidelines and what was used in clinical trials that were recently published. So when I was at UIC, we had an interest in identifying variants, as I mentioned, that were important in minority populations. And so we enrolled African Americans on a stable dose of warfarin from our clinic. So they're on a dose that got their INR between 2 and 3. We initially enrolled about 220, and actually about 20 of these are from the University of Florida through a collaboration we had here with Dr. Julie Johnson. And we looked at what dose they needed based on their genotype. We separated out STAR8 because we didn't know what the effects would be. No one had looked at it previously with warfarin, so we didn't know how it would affect warfarin. And the in vitro studies were actually inconsistent, so we didn't know what the effects would be. So there's really 3 things you can see from this graph. One is as many African Americans have a STAR8 variant as STAR2, 3, 5, 6, or 11 combined. They need significantly lower doses than the STAR1 genotype. It's about 1 milligram per day or 20% difference, which is clinically significant. And even though there's more variability with STAR8, similar low dose requirements with STAR8 as with the others that are well accepted to be associated with lower dose requirements. We then did a clinical pharmacokinetic study where we collected blood samples from our patients to see whether the STAR8 was associated with reduced warfarin clearance. And indeed it was. We had about 38 patients, and you can see that those who had 1 or 2 STAR8 variants had significantly lower clearance of the S enantiomer of warfarin compared to those with the STAR1 genotype, normal metabolism. We only had 2 STAR8, so we couldn't really do the statistical difference here, but you can see that it's similar to the heterozygous genotype. So in addition to work that we've done in our lab, we're part of this International Warfarin Pharmacogenetics Consortium, or IWPC. Dr. Julie Johnson, again here, she's the dean at the College of Pharmacy, and she's one of the ones who actually helped found this consortium. This consists of about 22 research groups from around the world who were all looking at genetic associations with warfarin dose requirements. And so what we initially did is we all pooled our data together from patients all over the world on warfarin to develop a dosing algorithm to predict dose that the patient would need. And the algorithm included clinical factors like age, body size, some interacting medications, and genotype. And the main genotypes that were included were CYP2C9, STAR2, and STAR3, and then the VCOR-C1 variant that I showed you. This was initially published, I believe, in 2010, so it's before we really had any information about the other variants that affected warfarin dosing. The most recent thing that we did was to do a genome-wide association study in African Americans that were included in the International Warfarin Pharmacogenetics Consortium. So here we actually pooled our samples together from African Americans. They were sent to Riken for genotyping. And I think we used a platform that looked at about 600,000 variants across the genome, and then we imputed additional ones. And what we found was a novel variant that was associated with increased or decreased warfarin dose requirements in African Americans, and it reached genome-wide significance. This particular variant is located in chromosome 10. It's in this region where CYP2C9 star 8, or CYP2C9, CYP2C8, CYP2C18, and CYP2C19 are located. So it's like a gene cluster. It's not in any one of these genes, but it's very close to CYP2C18. It's very common. About 40% of African Americans have a variant at this position, so very common. And when we looked at dose requirements, so here's our discovery cohort, here's the replication cohort of 400 and so patients, and you can see this is again milligrams per week, significantly lower dose requirements with the AA genotype versus AG and GG in both of these cohorts. We also did a pharmacokinetic study, which is not shown here, but it was published in the same paper, and we saw that individuals with a variant allele had decreased clearance of S-warfarin. So again, we have decreased clearance of warfarin leading to decreased dose requirements, and this is very common, about 40% of African Americans. So in 2007, based on the evidence at that time with the CYP2C9 star 2 and star 3 variants of the VCOR variant, the FDA added information about pharmacogenetics to the warfarin label. So if you pull the label now, it says that lower doses should be considered for patients with certain variations in 2C9 and VCOR. And then they further revised this label in 2010, and they have this dosing table so that you can look at the VCOR C1 genotype, CYP2C9 genotype, and it'll give you a guide for what dose to start in these patients. So for example, with the GG, which is the insensitive VCOR genotype, and normal warfarin metabolism, it's our usual 5 to 7 milligrams per day. On the opposite extreme, with a very sensitive VCOR genotype and poor metabolism, individuals may need as low as 0.5 milligrams per day. Notice that all of the variants that are particularly important to African Americans are missing. The CPIC guidelines I referenced earlier, and these read that they give a strong recommendation for dosing based on genotype when genotype results are available. They further recommend using a pharmacogenetic algorithm, and then if you can't access an algorithm, you can use the warfarin dosing table that's in the warfarin label. They reference two specific algorithms to use that they recommend. One is the IWPC algorithm that I talked about. Another is by Dr. Gage at Washington University. I'm going to refer to it as the Gage algorithm. It too contains clinical and genetic factors and is used to predict warfarin dose requirements. And I'll show you a picture of how you could calculate this shortly. Both of these are freely available through warfarindosing.org. So you can go to that site, plug in clinical factors, genotypes if they're known, and it'll give you a warfarin dose prediction. So in August of 2012, based on all the evidence that was available and the guidelines that said if you have genotype, you should use it for warfarin dosing, we decided at the University of Illinois that we would make genotype available for every patient newly starting warfarin in our hospital, and then we'd use that information to choose the dose of warfarin that they needed. So in these next few slides, I'll talk about the process that we used. So we built clinical decision support in our medical record. We used Cerner there. And so we had this screen for every new order for warfarin to determine whether the patient had had warfarin in the past. It looked at the inpatient records, the outpatient records, and the home medication list, so the list of medications they came in on. If they had used warfarin in the past, nothing further happens. We assume that we knew the dose of warfarin the person needed. But if there was no history of warfarin use in the past 6 months, then an order for genotyping was placed automatically, and an order for a consult with our pharmacogenetic service was also placed automatically. At that time, we had an alert that would appear to the ordering physician stating that genetic testing to determine warfarin metabolism and sensitivity is now routine, that a consult with our service would be provided to assist with interpreting the genotype and dosing warfarin. And then we also built an algorithm into the computer just with clinical factors. We used the gauge algorithm but without the genotype, and actually calculated a dose of warfarin for the patient based on age, body size, use of interacting medications, race, and smoking status. And so that appears here, so they could give the patient an initial informed dose until the genotype was available. The pharmacist on the service screened every genotype and consult order to make sure it was appropriate. So there were some instances where the patient actually came in on warfarin, but it was not documented on the home medication list. And so those, we would cancel the genotype and the consult, and we'd put a note in the medical record to that effect. For the others, we'd notify the lab to proceed with genotyping when the sample reached the lab. They genotyped every day at 10 a.m. for any samples that were available. They genotyped the VCOR variant, star 2 and star 3. And then we used an extended commercially available panel that also got variants important for African Americans, and then a few that are very rare but may affect warfarin dosing in persons of Native American ancestry. And then there was one in CYP4F2. This actually metabolizes vitamin K, and so if you have a variant here, you may need a higher dose, so we genotype for that as well. The results would be available in 6 hours. Warfarin's dosed at 9 p.m. at University of Illinois, and so we'd get the result back in time to inform the second dose of warfarin, and at that time the pharmacist and the physician would provide a joint consult. We would bill for that as a means of recouping the genotyping cost, and then the pharmacist would continue to provide a daily dose recommendation that we refined based on the INR results to previous doses. So to give you an idea of what we use, this is the gauge algorithm, or that if you look at warfarindosing.org, it brings you here. You can plug in clinical information about the patient, age, sex, race, ethnicity, body size, interacting medications. And then if you know the genotype, you can plug it in at the bottom, accept terms of use, and hit estimate warfarin dose, and it'll give you a dose recommendation based on those factors. There's also a place you can click to get the dose prediction by the IWPC algorithm on the next page. You can then save this information under a unique identifier, and you can go back the next day. You can put in the dose the patient got, what their INR was that next day, and it'll give you a refined dose recommendation. So we use this as a guide. It wasn't our final thing, but we used it as a guide, and then the pharmacist would further adjust the dose based on whether the patient was taking any medication that interacted with warfarin that wasn't on here, if they had significant renal impairment, which we know affects the dose requirements of warfarin, or if there were anything else going on with the patient where we knew we needed to refine the dose further. So we did look at the initial feasibility of providing the service, and we published this. So we looked at the initial 6 months of the service. We had 190 patients genotyped at that time. Most were African American or Hispanic, which is the population that's treated there. The median time to get the genotype results from the time of the first warfarin order was 26 hours. Most were available before the second dose, which was the goal. We provided the dose recommendation. We did not actually put in the order for warfarin, but we saw very good adherence of the medical staff with our recommendations. It was only about 60% initially, but it increased over time to over 80%, which we felt was really good. Some of the challenges that we encountered and some of the things to think about with the pharmacogenetic service, there has to be good infrastructure. There has to be clinicians that are knowledgeable in this area, that are involved in this area, administrative support, pathology support, support from information technology. So a number of things that have to be available for this to be successful. There's a lot of clinician resistance to considering genetic information. Part of this is just a knowledge gap. We don't routinely teach pharmacogenetics, or at least historically we did not in the clinician coursework. We're getting better at this now. The other is there's this demand for preferred evidence. So clinicians want evidence from randomized controlled trials showing that if you have genotype, it improves morbidity and mortality. And so this is one side of the coin. The other is, do we really need these data? Because in most patients, they're going to have the normal genotype. And so it's not going to be informative. It's the subset of patients with genotype associated with the extreme responses that we're worried about. And so rather than having to have this evidence that improves morbidity and mortality, is it sufficient just to know these variants are highly associated with this response if the patient has them? And can we use this as another tool to better manage or better prescribe drugs for our patients like we would a serum creatinine? There's also financial barriers in that ideally we want this covered by third-party payers so that the hospital doesn't have to pick up, the medical center pick up the cost for genotyping. And then finally, most of the data are from Europeans, so very limited data in minorities. There were 2 trials, randomized controlled trials. The clinicians were asking for it, and so they were done, that looked at genotype-guided warfarin dosing compared to a non-genotype-guided approach. The first one of these was, these are both published end of 2013. The first was called the UPAC trial, the European Pharmacogenetics Anticoagulation Therapy trial. The other was the COAG trial, which was clarification of optimal anticoagulation through genetics. And so this shows what they found. The UPAC trial, it was done in Sweden and the UK, so it was a homogeneous European population. They compared genotype-guided dosing with conventional dosing, which was 10 milligrams day 1, 5 milligrams days 2 and 3, and then dosing based on the INR. And they found that the genotype-guided dosing was better at their primary endpoint, which was time spent in therapeutic range, which is that INR of 2 to 3. There were fewer supratherapeutic INRs, and it was shorter for the patient to get to a therapeutic INR. The COAG trial had a very ethnically diverse population. A third of the patients were African American. They compared genotype-guided dosing using the gauge algorithm that I talked about compared to clinical dosing. This was using the same gauge algorithm but without genotype. They found no difference in any of the outcomes, and the outcomes were similar to UPAC with the 2 approaches, as you can see here. They then looked at African Americans because they took a third of their patients, and what they found is that genotyping was actually worse than dosing based on clinical factors, and all of these were statistically significant. So what were the difference between the COAG, that trial strategy, and what we were doing? Well, they limited their genotyping to the 3 variants important in Europeans, yet they had a huge African American population. We were genotyping for additional variants that are important in minorities. They used the gauge algorithm alone with no loading dose. We used the gauge algorithm, but with additional judgment, adjusting for factors that are also important for warfarin dosing. And in most cases, patients did get 1 or 2 mini loading doses. So unfortunately, when this trial came out, particularly when it showed harm in African Americans, we were very concerned. And we've been collecting data for quality assurance, and we saw we were not harming our African Americans. If anything, we were doing better than we were historically. But we didn't feel like we could continue making this the standard of care given these clinical trial results. So we had to eliminate the mandatory genotyping component of our service, and we kept it as optional. Interestingly, genotype is still ordered 50% of the time. So we sort of overcome, I guess, that barrier to clinicians being reluctant, and we did a lot of education after these trials came out, which I'll show you some of what we talked in the next couple of slides, what we talked about, but they still thought genotyping was important, and it's still being ordered. We've looked at outcomes with historical controls versus patients on our service, and that's a manuscript that's in preparation now. And now that we are eliminating the mandatory genotyping, we'll have the opportunity to evaluate outcomes in patients who receive genotype-guided dosing versus those receiving clinically based dosing, similar to the COAG trial, but in a non-randomized real-life setting. And again, we're working to continue to identify variants important for minorities because these were not included in the clinical trials. So why did COAG turn out like it did? We thought that it may have been a failure to genotype variants that were important in their African Americans. And so we hypothesized that in African Americans who have one of these variants we know contributes to lower dosing, like star 5, 6, 8, or 11 and CYP2C9, or the novel variant we discovered in the GWAS, these would be overdosed with the algorithms they used in the clinical trials. This would probably be of no consequence in the European trial because all the patients were European. But in the other trial, in the U.S., with lots of African Americans, we thought this could be a problem. So we had data from 274 African Americans on a stable warfarin dose, And basically what we did is we just looked at the dosing error in patients who did not have a particular variant and those who did. So this is just with CYP2C9. We had, most patients are non-carriers, but about 50 of them had one of these variants. This is the dose they actually needed to be therapeutic, and we knew, I mean this has been shown before, that carriers need a lower dose. This is the algorithm used in the European trial. This is the algorithm used in the COAG trial, which was the diverse trial. They don't account for these variants, so they predict similar doses in carriers and non-carriers. Interestingly, the algorithm they used in the COAG trial almost overdosed patients who are carriers. That was nearly significant. We then looked at the prediction error, so the difference between the predicted dose and the observed dose, and we saw the IWPC algorithm somewhat overdosed carriers of a variant CYP2C9 allele. The gauge algorithm significantly overdosed them by over 2 milligrams a day. A clinically significant difference would be at least 1 milligram a day, so this is a huge difference here. We did the same thing with the other novel variant, and again, we know there's lower doses required in the variant heterozygotes and homozygotes. The two algorithms predict similar doses regardless of whether they have this variant, since it's not in the algorithm. When we look at dose prediction error, the IWPC algorithm tend to underdose those with the least sensitive variant, while the gauge algorithm overdosed heterozygotes by 1 milligram a day and homozygotes variants by 2 milligrams a day. Again, this is 40% of African Americans have one of these fall in one of these categories. So we're currently working with other groups to develop an algorithm for African Americans or to look at the effects of adding these to existing algorithms and how they work. I've got just a couple slides in Hispanics and then I'm wrapping it up. We've just started to look at variants that are important in the Hispanic population. Hispanics are even less well represented than African Americans in pharmacogenetic studies, warfarin and others. They're the largest minority population in the U.S. and one of the most rapidly growing. There's significant variation in their ancestry depending on where Hispanics are from. This shows the percent of West African, European, and Native American ancestry for patients from UIC. We tested 105 variants across the genome, or ancestral informative markers. And this pink one shows these are Hispanics from Mexican descent. You can see they have a lot of Native American ancestry. Those with more Caribbean descent tend to have more African ancestry. Interestingly, Hispanics are also at greater risk for serious bleeding like intracranial hemorrhage, which is the most serious or one of the most serious adverse effects with warfarin. And so they could particularly benefit from a method that improves dosing of warfarin in this population. We've done some very preliminary work in this population to look at what's important for dosing in Hispanics. Overall clinical factors, if you look at age, body size, and history of AFib or A-flutter, they explain about 36% of the variability in dose. If you also look at CYP2C9 and VCOR genotype, this now explains about 60% of variability in dose. We looked at a couple additional variants. This one at NQ01, NADPH quinone oxidoreductase 1 is involved in reduction of vitamin K. Interestingly, it's associated with increased dose requirements in Hispanics. This is not something that we expected, but now it's explaining nearly 70% of the variation in dose. So suggesting that there are variants that are very important in Hispanics and that there may be further work that needs to be done to further define these. So in summary, we showed that implementing a warfarin pharmacogenetic service into practice was feasible. We have outcomes data forthcoming. We saw a number of challenges with implementation, not just with this, but with other drugs as well. And so there's efforts ongoing to address these challenges. UF has really been a leader in this personalized medicine arena. They have a large grant from the NIH to implement personalized medicine, which is one of the reasons that I came here, is to help with that program. It's directed by Dr. Julie Johnson. And there's a number of examples of successful implementation, including those at UF. And then we're still undergoing research to try to better inform therapies for minority populations. So thank you so much for your attention.
Thank you so much. We have time for one question.
Yes, the victim that phenotype has the interaction between the genotype and the iron still holds true. Do you think including the microenvironment, i.e. the physiology, would be an important input into the database creation?
Yeah, so the question
Can you
is,
just- yeah, oh, yeah.
the question is, what is the impact of the environment in addition to genetic factors and influencing response to warfarin and other drugs? And warfarin is actually a really good example here because we know diet, as I mentioned, vitamin K intake is very important for warfarin dose requirements. And so we don't really account for that very well when we dose warfarin. It's not included in the algorithms. Part is that it's very difficult to quantitate the amount of vitamin K that people are consuming, but it is a very important factor. And so genetics and clinical factors will never explain 100% because there's other things such as dietary that's important. Thank you.
We actually have time for one more question. Marcel?
So there are multiple platforms or ways to genotype nowadays, from a few SNPs or a few hundreds or thousands in large panels. As you move pharmacogenomics as a whole to say, a operational clinical level, do you see the hospital being easier to genotype a large panel that work for any drug, or specific panels are cheaper, or how do you actually see that?
Yeah, so the question is about the use of panels that would genotype multiple SNPs that may be relevant for multiple drugs versus sort of genotyping for this drug, this drug, this drug. And it really gets, there's a couple of things here. What we're doing right now is largely reactive genotyping. So like they're prescribed warfarin, we genotype for what's important for warfarin dosing. They're prescribed Plavix, we genotype for what's important with that. And it seems like it could be a waste of resources. We're doing genotyping individually every time, and we're having to do it very quickly when the drug is prescribed. However, it is reimbursed by third-party payers for some of these drugs, not so much for warfarin, but certainly for Plavix. The other approach, which we're also very interested in, is this panel-based genotyping. So preemptively genotyping people for a large number of variants that could have implications for multiple drugs, putting that in the medical record, and then as drugs are prescribed, that information's already there to inform the appropriate drug therapy or help inform the appropriate drug therapy. We actually have a panel here that we did use initially when we were doing our Plavix genotyping so that we could have not only the Plavix genotype but these other genotypes as well for drugs patients may need in the future. The problem came to when we billed third-party payers and what they would reimburse for. There is potentially, we hear, a move by Medicare to maybe start providing reimbursement for some of this panel-based testing. I think it is probably a better way to go, and so hopefully we will get to that. Thank you.
Thank you.
Okay.
All right. Thank you, Dr. Arisa. So we're moving now from a system that clearly is very well understood, where all the individual polymorphisms have, or at least a large part of the individual polymorphisms have been uncovered, to perhaps questions that relate to traits that might be a lot more complex in nature when we're going to talk now about animal breeding and plant breeding. It's my pleasure to introduce you to Dr. Guilherme Rosa. Guilherme got his bachelor's, his master's, and his PhD from the University of São Paulo in Brazil in animal science and animal breeding. He then went on to do a postdoc right in Madison, University of Madison, Wisconsin. He stayed there for a few years, and then he took an assistant professor position right in Michigan State University. Stayed there a few years, 4 years. Then I guess he figured that the weather probably was better in Wisconsin, right? Because the weather is wonderful there. And he moved back to Wisconsin as an associate professor. He recently became a full professor in Wisconsin. Guilherme, thank you. And just a quick note, we are making some small changes here in the live streaming to hardwire it. So it's going to take probably a couple of minutes for it to go online. Okay? Should we wait for it? Okay,
So I should put both here?
yeah, that's right.
Yes, both on the last one.
We need to make sure this one is not touching the other, because otherwise it's going to.
And I don't know where the top is. Full screen. Sophia. Full screen. I need to wait, right?
Thanks for writing that letter. Thanks for writing that letter.
The people that are in the distance, they have access to
See that? Yeah. See that? And they see also here.
Okay.
Yeah. We good? All right.
Okay. Good morning, everybody, and thanks for the organizers for the invitation to join this workshop and present our research. Actually, what we are going to do today is it's mostly a review, and then I'm going to show some results of recent publications, not only in our group and outside as well. So it's going to be a more methodological talk. We are going to talk about model specification, model selection. So if you work in genomic selection or genome-enabled prediction, you've seen the enormous variety of models that people use, and they give letters, base A, base B. So we are going to see how we can compare them, how we choose between these models, and also how you decide for variables that you are going to, covariables that you are going to use in your models, what kind of distribution you assume for your response variable, and so forth. So I start with a brief overview of genomic selection or genome-enabled prediction, and the traditional regression methods and ordinary least squares, and then I'll start talking about more the methods that we currently use for genomic selection, shrinkage estimation, and how we compare models, and the different components that we need to think about when choosing a model. So the first talk was in personalized medicine, so you want to predict the response of an individual to a drug. People use also this kind of methodology in preventive medicine. But in agriculture, we use, in addition to optimized management, we use for selection. So we want to select individuals with higher merit, genetic merit. So we start with a reference population where you have genotypes and phenotypes available, and then you go through this stage that's where I'm going to focus my talk, that is the data analysis. So you're going to train a model, try to regress the phenotypes on these markers, and then you have a new set of individuals, like selection candidates, like possibly younger individuals that you have genotypes, and you use your prediction model to select those that are superior. And of course you may get phenotypes from them later, and you are going to use this information also to retrain your model. So the genome-enabled prediction approach is then, like I said, the regression of phenotypes on a function of genotypes. So W's are the genotypes of individuals for a number of markers. Okay? So we are going to focus today on regressions. So this function of genotypes, we will be restricting our discussion today on linear models. So a sum of additive effects first. So you have the genotypes, for example, coded 0, 1, 2, and then you have the marker effect as the B's here. I'm sure in our last talk we're going to expand this to more complex models where you try to incorporate non-additive genetic effects. Okay? So if you have residuals assumed to be independent and with a common variance, you are in an ordinary least squares situation. You can apply the simple least squares approach. So the phenotypes, this linear combination of the genotypes and residuals. So I'm going to be talking about this matrix W. That is the matrix of genotypes. So each row is the genotype of one individual, and the columns are the SNPs, for example, SNP markers. So just to make the discussion easier now, let's assume that we have a phenotype centered in 0 here, no intercept, just because I'm going to talk about shrinkage, and let's shrinkage everything in the beginning, and then we'll show some variations of this. Okay, with the ordinary least squares, and first let me mention that we have a problem in genomic selection where the number of markers or the parameters that you have in your model is much larger than the number of observations. So least squares is not an alternative for us. We don't have degrees of freedom to fit a model like this. But let's assume that you can first, so the least squares you are going to minimize this sum of square of residuals, the residual sum of squares. And written in a matrix form, you get this estimator. So this W, that is the matrix of genotypes, so transpose W, inverse W transpose Y. Okay? So the expectation of this estimator is shown to be 0, and with this variance. Okay? And when we choose an estimator, we look mostly to these two things, like bias and variance. And a good way of combining these two things is to look at the mean square error. That is the expectation of a square of the expectation of this is the square of this difference, and it's the variance plus the square of the bias. What is interesting to notice that, like, if you have a ordinary least squares estimator, theta hat, so we know that this is unbiased, like I showed. If you have a new estimator that is constant alpha times this estimator, and the constant is smaller than 1, now you have a new estimator that is biased if theta is different from 0, but the variance will be smaller because alpha squared is smaller than 1. So you may find an estimator that the mean square error is better, so you pay a price in terms of bias, but you gain a lot in terms of variance. And this is also true for prediction. Sometimes you want to predict a future observation, and you pay a price in bias, but you improve a lot in variance, so the prediction mean square error is smaller. So I mentioned to you that least squares, the ordinary least squares is not an alternative for us because we don't have degrees of freedom to fit a model like this, because the number of parameters in our model is much larger than the number of observations. This is true in any agricultural application of genomic selection. You have thousands of markers and a few hundred or a few thousands of individuals nowadays available with the genotypes. So what we do in general is to use what we call penalized methods. So very similar to ordinary least squares. So you have a component here in terms of the square of residuals, but now you put a price on the dimension of the model. So I'm going to show some variations of this penalty. And also we have a Bayesian version of this penalized regression. And I'm going to discuss some of them because they are very commonly used in genomic selection. There are many other dimension reduction techniques, alternatives like partial least squares or singular value decomposition. We use stepwise regression a lot in different applications of statistics, but today we are going to focus on penalized regression and the Bayesian version, that is hierarchical modeling. Okay? One of such penalized regressions is called ridge regression. You may be familiar with this. So the penalty that you put here is on the square of the estimates. Okay, so you penalize, you are going to add you are going to add the square of the estimates, and then you have a regularization or complexity parameter in your model that you need to monitor this, for example, using cross-validation, as we're going to discuss. So now you minimize this sum of squares, but with a restriction on the size of the model. Okay? And then instead of having here W transpose W minus 1, what the ridge regression does is to add a constant, and this constant is lambda, to the diagonal of this X, W transpose W. Okay? Another very common approach used in genomic selection is the lasso. So here the penalty is on the absolute values of the regressors. Okay? So this is an interesting approach because it does not only shrinkage of the estimates, but also zeroes out some of these regressors. So that's an illustration of how this happens in a graphical illustration. So suppose a model with two parameters, beta 1 and beta 2. So this would be the least squares, the ordinary least squares estimate of beta 2 and beta 1. And these are the contours of the residual sum of squares. So this is the restriction. The lasso is like a diamond area or volume, and the ridge regression. So this would be the estimate. So the minimum. So you minimize your function with this restriction. So in this case, you are going to zero out beta 1 and have a beta 2 that is this. So you shrinkage both and actually zero out one of them. In a ridge regression, you have here the estimate of beta 1 and beta 2. So you regress both towards 0, but you don't zero out anyone. So and actually, you can think about this, well, this is not lasso. This is a general formulation of penalized regression. So you can think about different powers. So if you put power 2, you have the ridge regression. If you put power 1, is the lasso. And you can think about different penalizations on this regression approach. Okay? But why we do this also? There is no way you can fit linear ordinary least squares in this kind of data. But also what we are trying to accomplish here is a bias variance trade-off. I told you that you may pay a price in bias and gain a lot in variance, and that's exactly what we are trying to do when you work with this penalized regression. So suppose you have a situation where you are modeling y as a function of x, both like continuous variables, a regression model like polynomials, for example, and you fit a linear regression. You may be simplifying too much your data, right? So suppose you have a quadratic function here underlying this data. So this is a over-reduction, a simplification of reality. But also, if you go to the other extreme, like you have 6 data points, so 5 degrees of freedom, if you put a polynomial with order 5, you are going to copy your data, right? You are going to have your regression passing over all the data points. And this is going to give you what we call overfit. This model, when you go to you try to predict a future observation, it may have even a worse prediction than this model. This model is going to give you bias and low variance. This model is probably no bias, but a very high variance. So we need to find out which model is better and probably something in between. So what we do in general in statistics, in any application of modeling, is to look at goodness of fit and model complexity. Okay? So you may be, so how you can measure goodness of fit? For example, look at likelihood, and you can compare models using likelihood ratio test. And model complexity, you can look at the number of parameters, effective number of parameters. So you may be aware of this model selection criteria that people usually use, like AIC or BIC. What they are trying to accomplish is a compromise between model complexity and goodness of fit. Okay? So they look at the goodness of fit and they penalize in terms of the model complexity. And they are trying also to improve prediction of future observations. Okay? We are going to be using Bayesian models, Bayesian approaches here. So in Bayesian model comparison, we have some different approaches also. The Bayes factor is the formal Bayesian approach for comparing models. It's kind of difficult to calculate Bayes factors from MCMC, like if you are using like deep sampling for implementing Bayesian models. And also it's not defined if you're using proper priors. So people try to use other approaches as well, like methods based on posterior predictive ability, and also the DIC. DIC is very commonly used in Bayesian model comparison. Some people that work in more methodological area, they don't like too much, but people that working more in data analysis, they use a lot DIC to compare method. So I told you this bias variance trade-off, and this is a illustration from the book of Rusty and collaborators. It's very shows exactly what happens if you have a data set and you fit a model and you add covariates in this model and you look at the prediction, the ability of prediction of the samples, the observations in the sample that you are using to train your model. As the model gets more complex and more flexible, the prediction error goes down. And actually, you may go to a situation where you copy the data. Is this good or bad? Well, if you go to an independent sample, for example, and you try to predict those observations that did not contribute to the estimation or the training of the model, the prediction error goes down until a certain point, and then you may be getting to overfit, and the prediction gets worse. So you need to find this good balance between model complexity and goodness of fit or biased variance trade-off. What we do in this case, so you want to assess this, but we have a data set that comes to you, and you need to assess prediction ability. So what we do is to use cross-validation, or we mimic a situation where you have a data set available to you. So this is all the data that you have. You split in two parts. You use part of the data to estimate parameters in your model, or to train the model, to fit the model, and then you look at how good this model works on the additional data set. Okay? So we call training and testing sample, and then you can compare observations with predictions on the testing sample. And I'm going to discuss different metrics that you can use to compare models, okay, in terms of prediction ability. Another approach that we usually use is cross-validation. Instead of just breaking down your data set in two components, training and testing, what you do, you break in many components, like the k-fold cross-validation. You break your data, you split in k components, like 5 in this case, and then you use 4 to train the model, and then you predict the 5th. And you do this 5 times, each time one component, one fold left out. Okay? In the extreme, you can use the leave one out. So you run your model n times, and each time one single observation is out of this fitting or training step. Okay? And then you compare observations, realized values with predictions. Okay? Okay, so let's talk about model specification. I'll start here with the simplest model that we in general use in genomic selection, and then we'll see things that we can change or things that we need to think about when using genomic selection. So this is a quote from George Box. He was the founder of the statistics department at the University of Wisconsin. So he said all models are wrong, some are useful. And actually I'm going to show in the end of this talk that some models are wrong and even harmful. So, so you need to be careful. But anyhow, so let's go back to our regression, linear regression, and let's assume normality of our response. You just start with like you have body size, milk production, yield in corn, whatever. A trait that you are comfortable with a normal distribution is a good approximation, at least for the response variable. So this is the density. So you have the joint density is the product of these normal distributions, and you can write like this, right? That's the density of joint distribution of normal traits. In a Bayesian approach, so we have the distribution of data given the parameters. So what we need to do is to put priors on the parameters. So let's start with this set of priors. I put an improper prior, like a flat prior for this intercept. And then I put normal priors, actually independent normal priors for each of the marker effects, additive effects in this case. And I put inverted gamma or scaled inverted chi-square distribution. Okay, would be a standard approach, and actually this is a kind of Bayesian ridge regression. Okay, so what sort of things we can change in this model? Well, first the distribution of the phenotypic traits. So you may have a different distribution of your trait. For example, in the previous presentation, we saw a distribution of this. I forgot what was the component that you had from 10 to 70, and we see something that it was a skewed distribution, right? So maybe you can use a transformation to try to bring this distribution to a more symmetrical distribution. Or we may want to find a distribution that fits better than a normal to your data. And then another thing that happens in genomic selection is that sometimes you get data that is pre-processed. So I'm going to discuss this. You may have seen applications where people use the observed phenotype. Sometimes they get estimated breeding values that come from the field with the pedigree information, or something called deregressed proofs. So we're going to take a look quickly on this. And then something that I'm very interested is on how you decide the linear predictor for this regression, not only in terms of non-additive genetic effects that you can include, but more important, additional covariates. That's where, like I told you, you may get some harmful models depending on what you put here. Okay? And then I told you that we have these models like Bayes A, Bayes B, Bayes C. So these models are different between each other in terms of the priors that we specify for the genetic components. So I'm going to show them as well. And then I'll finish discussing some metrics that we use to compare prediction ability of these models. Okay? So distribution. So instead of using always normal distribution, we can try to find a better distribution that better describes the data generating process. For example, you can use a broader group of models called generalized linear models. If you have, for example, binary data, if you have counting data, you can use distributions from the exponential family to better accommodate this kind of distributions. And they are very simple. You just need to define the distribution that you want. Instead of normal, you can assume a gamma distribution or a binomial or Poisson. The linear predictor, as you need also in the linear regression. But now you have an additional component that is called link function. You need to find this link G that links the expectation of the response to this linear predictor. Okay? But it's very similar. We have software available to fit this kind of models the same way we fit linear regression. So here an application, before I get into agriculture, this is a human application with skin cancer. So in this case, you had yes or no as the response. Yes, cancer, no cancer. So we used a probit. So it's another, people are used to the logit or logistic regression. That's another competing model that is very similar. It's just the link function that is different. It's a probit link instead of the logit. So we use a lasso, the lasso technique, but with the probit link. And then we show the prediction ability. We had many covariates like environmental, like smoking, and then sex and other covariates. We add the pedigree information, prediction improved, with some principal components trying to combine S&Ps, and using the genomic regression as we are going to discuss here with 41,000 markers selected from a set of 500,000, so you get the best prediction. Phenotype distribution, like I said, you can try, for example, generalized linear models, but you may have even a more complex distribution, and you may need to try different distributions or maybe a transformation. And I mentioned George Box. That's the George Box that came up with this, Box and Cox, David Cox and George Box. They proposed this transformation. So you have the inverse, logarithm, square root, square, all as subcases of this. Okay, another thing that we need to think about when using genomic selection is what kind of phenotype or pseudo-phenotype we are going to use. In general, we have, especially in animal breeding applications, we have this group of individuals with both genotype and phenotype. But then we have individuals that are genotyped only and they don't have phenotype, especially for sex-limited traits like milk production. We have genotypes on sires, but we don't have milk production on them. We have on the daughters, and then you have maybe the phenotype, but not the genotype. And we use all this information to try, we combine all this, for example, to estimate breeding values. And then you can use the breeding value, estimated breeding value, as your pseudo-phenotype. So that's something that you need to think about if you're going to use individual phenotypes, if you're going to use, for example, average of progenies, or the EBVs, or what we call de-regressed proofs. The EBVs, they are calculated using BLUP, so it is a shrinkage approach. So depending on how much information you are going to produce more or less shrinkage. So the idea is to de-regress these proofs and then use the amount of information as a way, like to weight the residuals of this. So we are going to have a talk on non-additive genetic effects. And what we see in general is that if you use these EBVs or de-regressed proofs, they have been already processed with linear models, with many assumptions. So in general, when you use these methods, you don't see much difference between models with or without additive genetic effect, non-additive genetic effects, or different priors. So sometimes you need to go back to raw data to be able to model this kind of signals. This is just one application where people a group compared the EBVs and de-regressed proofs, and in this application they show that the predictions were better using the de-regressed proofs. De-regressing proofs is important if you have reliabilities of the EBVs very different between individuals. So it's important to weight this amount of information on the genomic selection. So you need first to de-regress and also to remove the parent average, so you don't do the double counting, as we call. Okay, something that I think it's also very important is how we establish the linear predictor. So I mentioned to you that we are, in the beginning, modeling only additive genetic effects, but of course you may be interested in modeling dominance, and there are different ways you can include dominance. But imagine that if you have 100,000 SNPs, so you have 100,000 additive genetic effects. If you want to include dominance, you are going to double the number of parameters to estimate, and things get even worse if you are trying to model interaction in a regression approach like this. But it is still possible, and there are ways for you to reduce dimension on your model. One example where people included dominance. So you have these different models that we're going to discuss, base A, base C, and then variations where they include dominance. So the accuracy, so this is simulated data. So they have the breeding values that they simulated and dominance and the total genotypic value. So and they show that even the accuracy of the breeding value, the additive component, was better when you include the dominance compared to the models with no dominance. Okay? So it may be something important, especially if you are working with crosses or hybrids and so forth. priors of marker effects. I told you that I mentioned to you base A, base B, base C, ridge regression. So the difference between them is basically on the prior that you put on the marker effects. So the ridge regression, you use a normal prior. And if you look at the base A, what we are doing is to use a thick tail distribution, and it's the T distribution. So it's you put more mass on the tails of this distribution, the prior distribution, such that you allow some of the SNPs to have larger effects. Some other thick tail distributions are with the double exponential distribution, that is the Bayesian lasso, and some mixtures, finite mixtures, like base B and base C. A review of all these models. There are many reviews, but these two are very interesting. In 2009 and 2013, they discuss all these models. On application, there are many people that compare different models, and I pick one from here, from Florida, and Marcio is the last presenter today, Dr. Rezende now. So he looked at many traits and compare here ridge regression, lasso, base A, and base C pi. That is a variation of base B. And not much difference here, but if you go to different applications, you see sometimes for one trait, one model gives better prediction, another model for another, it's better for another trait, and so forth. So it's very trait specific, and the number of markers that you have, the architecture of the trait, and so forth. Okay? But I would say use many of these and compare them. One thing that is interesting about this thick tail distributions is that most of them can be written in this group of we call normal independent distributions. So if you have a T distribution, for example, it can be written as a normal distribution times this inverted gamma, and then you integrate this W, this variable here, and you have the marginal T here. So all these distributions, all these models, they can be written in this normal independent context. So the ridge regression is normal. Base A, that is the T, you just use inverted gamma or scaled inverted chi-square for the variances. For base C and base B, you have a mixture of two distributions. Bayesian lasso, you have an exponential distribution of these variances. Okay? So if you are interested in generating a new model, you can call base X and just come up with a different distribution for the variance. Okay, so how we compare these models then? I show that there are many model comparison criteria like DIC or AIC, BIC, but because we are interested in prediction, the most commonly used approach is to run a cross-validation approach. But still in a cross-validation approach, what should we look at? The correlation between observations and predictions, or the predictive mean square error, or what? So let's go over some of these metrics. The most commonly used is the correlation. Of course, you need to decide what you are going to correlate here. So what we are interested in is the prediction of the genomic EBV with the true breeding value. But we don't have the true breeding value. So you may correlate it with your phenotype, or you may correlate with the EBVs that you have from the pedigree, and so forth. So that's one problem with the correlation. But even if everything is okay, you have a good metric in terms of the association between the prediction and what you want to predict, you have a problem sometimes of bias. So you have a model that is consistently biased, and we still with the same correlation of another model. If you are just going to select the top animals, maybe it's not a big problem, the bias. But for example, if you are going to allocate, like mating allocation will be based on the predicted breeding value of the animal, then you may be interested in assessing how much bias you have. So you may regress GBVs on EBVs or phenotypes to have a sense of this bias. Other metrics that we use is combining bias and variance, so you look at the predictive mean square error. If you are working on a classification problem like in the skin cancer that we presented here, yes or no, you are classifying individuals in these two groups. So you may be interested in looking at the area under the rock curve. And in terms of agriculture, you may also want to look at the selection effectiveness. So when you look at the correlation, again, you are looking at all the whole data set that you have, the correlation. But what you are interested in is the ranking on the top animals, right, or plants. It doesn't matter how well or worse or bad the model works in the bottom of this distribution. So you may want to look at the top, how you rank the top individuals. One thing that is important also, that no matter which metric you are using, the prediction ability is very dependent on the genetic relatedness between training individuals and testing individuals. Okay? So when you are using a cross-validation approach, you need to think about this. And in general, you try to mimic with the cross-validation the way the model is going to be used in practice. For example, if you are going to select on the next generation, so maybe you want to break your data on older individuals for training and younger for testing and so forth. In this paper, what we did was to look at different cross-validation layouts. For example, choose individuals that are less related when allocating testing and training, or generational, or at random, and so forth. And of course, it's evident that if you have a more stronger relationship between individuals in the testing and training set, you are going to have higher correlation. Okay, I'm coming to the last part of my talk. This is a review paper that we published recently. I think it's available online in the last 2 weeks, where we discuss these metrics. And I'm going to show another paper that it's available only in our archive, so it's under a review now, but it's available in archive if you want to take a look, where we show that even these metrics, all these metrics may be not a good approach to go, depending on what you want with your models. But let's look at the metrics here. What is happening with the data that we have? So we have this P larger than N, many more markers and parameters than observations, and things are getting worse because we are genotyping more animals and plants, but the number of SNPs is growing much faster because we are approaching to a situation where we're going to sequence individuals. And after we sequence, then we are going to look at methylation levels. So we never stop in terms of what kind of variation we want to incorporate. So this is what we see in livestock. So the number of markers is growing much faster than the number of individuals. Okay? So what happened in this case is that this regression approach that we are discussing here may not work well. So we may need some other techniques that I'm not discussing today, although we use a lot, like machine learning techniques. Probably Marcia is going to mention this, I don't know. Or we need to find models with different shrinkage. So instead of treating all markers similarly, we may need to treat them differently based on biological knowledge that we have. Are they in genes or intergenic regions? Are they synonymous or non-synonymous genes, and so forth? And in the end, if you know the causative variants, that would be the perfect work. So in this regard, we are doing some analysis, first to understand what kind of biological information we get out of this analysis, and then how we can use them in the genomic selection models. So this is a paper published also this year by Rostan, Abdullahi R. Planahi. And this is with chicken data, body weight, breast meat, and house hen production, 600K SNP chip, 1,300 individuals. What we did was to look at markers with different minor allele frequency levels, different chromosomes, and marker density, and look at how much the prediction ability change. So we saw, for example, that minor allele frequency SNPs were very informative, for example, but I'm showing here that just by splitting. So we run a genomic selection approach or GWAS approach to get effects of each SNP, and now we split in 5 groups with the largest effects, and then we feed genomic selection model only with those, well, like one model for each of these quantiles. And then we saw that the prediction, so that's the correlation between observations and prediction, was larger on this SNP. So when we move from the traditional marker-assisted selection, where we saw that the selection of few markers based on significance was not a good approach, and genomic selection was interesting because we could put all markers in our model, now we are getting a situation that we have so many markers that some filtering may work, may be important. And then another, I still work with this data set, trying to use genome annotation information in your model. This was published by Gota Morota in this year as well. So just one plot of the results. We have here all the markers that we had available, and then here different, like we are using coding, sequencing, exons, and genic or intergenic. So these are intergenic regions. So we select, like, for example, coding DNA sequence, and then that same number of markers in different regions, like intergenic regions. So we see that the prediction was much better here than here, and better here in exons than non-exons and so forth. So it seems that we can use this kind of information to improve prediction ability. Okay? So we are actually going to a situation where it's not, the prediction is not going to be this only black box where you use only statistics to build your model, just maximize prediction. We need actually to go a little bit further in terms of causal effects. And that's my last set of slides, where I'm going to show we are very interested in graphical models. So we try to represent causal effects with graphical models. For example, this is a variable that affects, like A affects C, and A affects D, and B affects D, and so forth. So, for example, C and D are 2 variables that are correlated between each other because they have a common factor A, okay? But they don't have a common, like C doesn't cause D or vice versa. You have a correlation between B and D because B causes D. So when you have correlations can be good for building prediction models, but for causal effects, it's a much difficult task. Okay? But if you can do this, it's interesting. But at least you need to understand that sometimes prediction is not what you want, because look at the. Well, let me just show this. What happens when you look at marginal and conditional dependencies, and then show an example where you can make a big mistake. Suppose A causes C or changes C, and C affects B. So there is a marginal covariance between A and B. So I can use A to predict B, for example, right? But if I put in my model the C as a covariate, so I'm conditioning on C, now A and B are independent. Same thing happened here. So if I have a common factor C affecting A and B are dependent. So I can use A to predict B or vice versa. But if I condition on C, they are independent, right? So if I have, so siblings, like let's bring this to a genetic component. So if I have families, individuals within families have a stronger correlation than in non-related individuals. But when you fix an individual or family, so you condition on a sire, then individuals are independent. But look at this situation. You have 2 independent variables, A and B, and they have a common child, C. They are independent marginally, but when you condition on C, they become dependent. Right? This is typical in genetics. So you have, if you are modeling genotypes of 2 individuals, unrelated individuals, these are independent. When they have a child and you genotype this, now you have a dependence on the genotype of it, right? So you generate a dependence because you condition on something like a common child. So let's look at this situation. That's an extreme situation, but I think it's interesting to illustrate what may happen. So suppose you have a phenotypic trait Y1 that affects Y2. For example, suppose this is body mass index, for example, in human application, and affects the hormone level of a specific hormone. And suppose you have a genetic component affecting this hormone level. So that's the real causal structure. If you model Y as a function of G, you don't find any prediction ability in this model. But then you condition on C, you generate a correlation between G and Y1. So here is correlation. So this is I'm conditioned on Y2 here, and the correlation was much higher, and this is no Y2, the correlation was lower. So meaning that if you are comparing these two models based on their prediction ability, this model is better. So the model where you condition Y2. And this is true. If you condition on Y2, you have a better prediction of Y1. But when it comes to selection, if you are selecting these individuals to produce a better generation, it's not going to work. Or if you are going to genotype here an individual that doesn't have Y2, this genotype is not going to help you at all on the prediction of Y1. Okay? So this is something that we are, that's our most current work, that is using these graphical models to build genomic selection models. So concluding remarks, model specification, of course you have many components that you need to think about when choosing a model. The distribution of the variable, the response variable, the linear predictor, and so forth. No universally best model. People try to sell the model that they invented, like if it's Bay A, Bay X, Bay C, Bayes D. But of course, it's a context dependent, trait dependent, number of markers, and so forth. It's important also to think about the choice of prediction quality metrics. If you are just selecting the top individuals, if it's for mating allocation, so you may want to look at correlation, prediction, mean square error, regression, and so forth. But also keep in mind that sometimes it's not the best prediction that it indicates the best model. It depends also in you need to think about the causal. When you put a covariate in your model, you need to think about what would be the underlying causal structure for that model to make sense. And then the old guys, they are much smarter than us, so I want to finish with this. Prediction is very difficult, especially if it's about the future, because that's what happens. So when you have data and you run cross-validation, things work much better than if you go to a real situation where you take your model and try to predict something that didn't happen yet. Okay? So I have a list of reference. All the citations that I have here are listed, so feel free to look at this reference if you're interested. Thank you.
Questions from the audience?
Yeah, one way by which you can reduce the number of information there is by phasing the SNPs into haplotypes, and therefore they become multi-allelic.
Yeah.
Did you look into that, or what's your view about
Yeah, that is a very good alternative as well. We didn't discuss, and actually maybe I need to include now. That's an important alternative. So you build haplotypes first, and then you, instead of working in a diallelic situation like this, you have multi-allelic, and it's especially interested to capture minor allele frequency variants in the middle of these haplotypes, and so it's a nice approach to go. Yes.
Since you're involved in breeding and improvement, you have models that can predict the amount of advance and the function, a model for the amount of improvement over generations when you have a certain selection coefficient.
So sorry, come again. So how we can how we predict?
Anyway, since you're doing breeding for improvement of various traits, you have models of the amount of improvement per generation.
So how you predict this improvement?
Yes, in other words, so I mean, if you have an original plateau or a certain functional relationship in the improvement over the generations?
Yeah, so I think there are two aspects on these questions. One is, if you go back to marker-assisted selection, we learned that if you focus on specific portions of the chromosome or very few markers or chromosomic regions, you go to fixation very quickly on those markers, those genes, whatever, and they carry a big chunk of DNA together, and you lose a lot in terms of variability, right? So genomic selection would be better in this sense because you are working on the whole genome. That's one thing. And also that you may be able to better control inbreeding in your population by genotyping individuals. Now, if it comes to the statistical approach, like to predict genetic gain, there are many problems here. For example, well, even in traditional selection, so you want a heritability estimate to predict your gain. And when you look at the realized heritability, you see a difference there. And I think one problem may be this. Imagine that I'm working in classical quantitative genetics, and I have a genetic component affecting Y2 here, but not genetic component, it's all environmental variation that you observe here. So there is no heritability of this trait. Heritability is 0. But if I condition, I'm analyzing Y1, so pedigree information, but I condition on Y2, I'm going to have a positive heritability estimate. But the genetic progress will be 0 because there is no genetic component. So there is also this problem when you try to predict genetic gain. And also it's always hard to compare our prediction with the realized gain because trend is something that also difficult to evaluate the genetic trend.
Time for one more question. So from a practical standpoint, if you're going to apply genomic selection, your strategy would be let's evaluate all the different models because they'll account for different architectures, they'll account for different variances and so on, and then make a selection of the model based on that.
Yeah.
What you apply.
Yeah. So yeah. If we are working with this pre-processed data that's very common in animal breeding, like if you have EBVs, like sires, you have genotypes on sires and the breeding value of the sires calculated based on many daughters, for example. So in this kind of data that you have already processed, you don't see difference between models, and then the GBLUP is a good approach to go. We didn't mention here. So you instead of working with a p-dimensional model, so many markers, so p is very big, you turn your problem to an n by n problem. So you have a matrix G that you need to invert, and then it's easier. But if it's not this case, if you are working with regressions, what we do is, yes, we compare models, and of course it's Bayesian implementation with Gibbs sampling, so it takes time. So in general, we run in parallel, you have many models, cross-validation, replications of cross-validation, so you split. And even for each replication, you may run parallel chains of the MC, and then you choose one that is working better. But again, you compare them using prediction ability, but you need to be careful if you include any other covariate, for example, because this is prediction ability. It's not going to tell you if you're doing a mistake. You need to think in terms of the biology that is known and the assumptions behind the model that you are plugging there.
Right. Thank you, Guilherme.
Thank you.
So we're going to take a short break now, about 15 minutes, and I should not trust that clock there. So it's 10:22. We'll resume at about 10:35, 10:40, okay, with Dr. Bernardo's talk.
From the agronomy department. So one of the things that last year we did is we tried to make the workshop that it can, fit with the variable areas that we're covering here in the universities, in animal, humans, and plant breeding. And last year, our first choice to be the speaker was Rex Bernardo. Unfortunately, we couldn't bring him last year, So we try again this year. So here we have Rex Bernardo. Rex Bernardo originally obtained his BS in agriculture in the Philippines in the 84, and his PhD in plant breeding in the University of Illinois in the 88. He was a former scientist in Lima grain genetics and a professor at Purdue University. Today, Professor Bernardo is a professor and endowed chair in the corn breeding and genetics at the University of Minnesota, and he conducts research in new ways to do breeding in corn, and also in educating students or the new plant breeders that are coming. And he has a very exciting talk today about not get too excited actually about genome-wide selection. So just a reminder, the people watching us online, they remember that you guys can ask questions, and please post it as soon as you have them, because we have a little lag between what is happening here and the online. So whenever you send the questions in the discussion period, the discussion might be over. So if we have time at the end, we're going to be able to cover those questions.
I've never had two microphones before. This is all right. I would like to thank the organizers for inviting me. It is my first time in Gainesville, and it's a pleasure to be here. I can't see anymore with glasses, so I need to take my glasses off so I can see. All right. So the title of my presentation is Let's Not Get Too Excited About Genome-Wide Selection. And you see the not and to are slightly smaller font. So yes, we still need to get excited, but maybe not too much as we thought we should be excited. I'll be referring to it as genome-wide selection. The literature also, it's more commonly called genomic selection. I prefer genome-wide for the same reason we say genome-wide association mapping and not genomic association mapping. And I come from the University of Minnesota. I started my career in the mid-1980s. I've devoted my career in maize, and at that time, in the 1980s, we used restriction fragment length polymorphisms, and some of you might remember what those were. They're a pretty expensive type of molecular marker. I remember my advisor called us to the field and said, we will collect DNA samples. We had to wear gloves so that our DNA did not contaminate the corn. We collected leaf samples that were about that big per plant, put them in a mesh bag. They were placed in a cooler, and then the cooler was driven to the local airport in Urbana-Champaign. There was a waiting plane to take it to the marker lab so that it could be analyzed right away. And I go, wow, that is an expensive type of technology. And here we are a few decades later when we have cheap and abundant molecular markers, and we can do things that were not imaginable when I first started my work on molecular markers. And looking back at the history of plant improvement, there are different things that you could call as bandwagons. And as we know, a bandwagon is something new and exciting that comes along, and everybody jumps on it. This is the greatest thing, we would say, since sliced bread. And in the history of plant breeding, there are different bandwagons, such as maize hybrids were proposed in 1908. There was polyploidy. We discovered we could treat plants with colchicine, double the chromosome numbers, have big plant parts, and we said we could have grapes as big as our fists. And then we had mutagenesis. We could generate all kinds of genetic variation. There was early generation testing, haploidy. You could go through the list. And now there were QTL mapping, association mapping, sequencing, genome-wide selection, and perhaps the next thing coming along would be advanced phenomics, where we could take phenotypic measurements with drones and other types of advanced technologies. And it's nice to take a step back and see, okay, has the technology worked? Has it delivered what it has promised? Or what are the things that it has not delivered? And at least in maize, I think we have enough information today to know what it can do and what it cannot do, and that is the topic of my talk today. So genome-wide selection in maize, after the initial hype, I think some main learnings are as follows. First, it often works. In fact, it usually works, but sometimes it does not. And we should be prepared to accept that. A main use of genome-wide selection should be in those phases in a breeding program when selection based on phenotype is not effective. And I'll give examples of that. If we have information on major genes, causal genes that affect the trait, we should incorporate that information in our prediction model. And I think now in maize, at least, we're at the point when we really should not have to worry too much about prediction accuracy anymore. I mean, we worried about it, and now I think we're at the point we shouldn't have to worry about it too much. Okay, if we look at a trait in general in a plant species, one way of subdividing those would be there are certain traits, such as, say, plant morphology or flowering date or disease resistance, that we may argue are controlled by relatively few traits, or at least traits that have some major QTL or major quantitative trait loci. And the idea is that if we have a trait that is controlled by a few major genes, it is possible then to identify these few major genes and then to build what we would call as a QTL idiotype or an ideal type. In this case, we use the molecular markers for these major genes like Lego building blocks. We take these major genes, they're Lego building blocks, and we assemble a target genotype by different standard breeding approaches. However, if we have a trait that is quite complex, just yield, that may be controlled by some unknown number of genes, let's say 30, 50, 100, 300, we do not know. In the first place, these genes would tend to have smaller effects, and so they are difficult to detect. In the second place, even if we are successful in detecting them, it is near impossible in a short span of time to put them together in to assemble a perfect genotype. In this case, we can't use this design approach as like Lego building blocks. So now we shift from a design approach or an introgression approach to more of a predictive approach. Instead of using molecular markers to build something, we use molecular markers to predict which are the best candidates in the population, knowing that the best candidates probably do not carry all of the favorable alleles at the target loci. And so the basic model we have, the phenotypic value, P is equal to genotypic value plus E, G plus E. And what we're simply doing with molecular markers is we're saying, well, the P, the phenotypic value, we now model it as the sum of the marker effects that are carried by the individual and plus still some residual effect. In this case, what we're saying is we are simply using molecular markers as a surrogate or as a substitute for genotypic value. And as has been discussed earlier, there are different models to do that. A model that we routinely use in our program is ridge regression block. Marker effects have a mean of 0, and the variance of each marker is equal to the total genetic variance divided by the number of markers. Meaning that if we have 100 markers, we're building the model so that each marker accounts for 1% of the variation. If we have 200 markers, we're building the model so that each marker accounts for 0.5% of the variation. And so how it works in practice is that we have our phenotypic values that could be from field trials or yield trials of our species of interest. So you could have traits such as yield and maturity and lodging and so on. At the same time, those same candidates are genotyped at a large number of single nucleotide polymorphisms or SNPs. Now we can combine these two pieces of information then as our training population to tie in the molecular marker data to the performance data and to create a prediction model. And so based on the training population, we can then, or in different statistical models, we can estimate what the effects of the markers are. Now, before we use that in practice, we want to know how well the model works. And so what we typically do is we actually subdivide our initial population into a training population for creating the model and an independent validation population to test how accurate the model is, and we calculate the prediction accuracy. And if we're satisfied that the model works well, then we apply to this the marker effects to a test population that has been genotyped but that has not been phenotyped. And so again, you see from the big picture here, we're simply using molecular markers as a surrogate for phenotyping. These molecular markers provide a link between the test population and the training population that again has been genotyped and already has phenotypic data that are available. And so, lesson number one we have found is that genome-wide selection often works, but sometimes it does not. And my group was fortunate to be allowed access to nearly 1,000 biparental crosses from the Monsanto company, from their maize breeding program. So when I say a biparental cross, it's a biparental cross is the cross between parents A and B, and then there were about 100 progeny developed from each cross. Those progeny have been evaluated for hybrid performance at multi-location trials and been genotyped for a certain number of molecular markers, and then there are nearly 1,000 of those individual crosses. And so our first question was a simple one. We wanted to know, well, how do genome-wide predictions perform? How accurate are they on a large scale? If we were to implement this on a large scale, what would we find? And so we have here the mean prediction accuracies for different traits. On the right would be grain yield. You have test weight. You have moisture over here and maturity. Plant height is this panel, and then ear height is over here. And so what we see then is for different traits, there are different mean prediction accuracies. And as well as for each trait, there is quite a bit of variability in the accuracy of prediction that we can get. Take yield, for example. The mean prediction accuracy was about 0.3. However, you would see the two middle quartiles here. There's quite a distribution. And then if you're a graduate student and you studied, say, one or two populations as part of your PhD thesis, and you happen to pick one of these with prediction accuracies of 0.8, then you think that, wow, I did a great job. The procedure works spectacularly well. I should get my degree without any problems. And if you were unfortunate and you picked these two guys in the bottom here, where, mind you, the prediction accuracy is negative 0.2, then you would say, well, genome-wide selection sucks, and I'm in trouble, I might not finish. The point here is that there is quite a bit of variation in prediction accuracy among different traits, as well as among different populations for the same trait. Sometimes it works, sometimes it doesn't work. On average, it works well. On average, it works well. Meaning that if we are to apply this routinely, on average, we will get positive gains. It's kind of the same as phenotypic selection, right? You do your field trial. Sometimes you get a very high heritability and you can get a good response. Sometimes your heritability is 0 and you expect a 0 response, and you accept that anyway, and as a breeder you still continue doing phenotypic selection, and we do breeding progress that way. Okay? So that's the first lesson. Now, we wanted to drill down a bit further and see, well, what are the factors that affect prediction accuracy? And we know from theory and empirical experiments that there are several things that affect this prediction accuracy. One is the size of the training population. Second is heritability of the trait, meaning that if heritability is 0, all effects are non-genetic and we should not expect anything. If heritability is 1, then we have a very nice scenario to work with. Third would be the number of markers. A fourth is the similarity, genetic similarity between the training population and the test population. And the fifth is the trait itself, we've found that you could keep everything constant and still for different traits you see different prediction accuracies. Now, Detweiler in 2008 and 2010 derived the expected prediction accuracy through this formula. And so this is the expected correlation between the true genotypic value and the predicted genotypic value. It's a function of the size of the training population, n. It's a function of the heritability of the trait, which is h squared, and what is called the effective number of chromosome segments. And so what's interesting here is that, again, the larger, as we would expect, the higher the heritability and the larger the size of the training population, the more effective the predictions would be. However, these two terms do not act in an additive manner. It's actually the product of the two. Meaning that if we have a trait that has a low heritability, we can compensate for that by having a larger population. However, if we have a highly heritable trait, then to maintain the same prediction accuracy, we do not need as large a population. This ME here is an idealized concept. It's equal to the effective number of chromosome segments that affect the trait. The way to think about this, it's the equivalent number of loci or the equivalent number of genes that would be controlling the trait if these loci had additive effects, if they were unlinked, and there was no epistasis. So again, it's this beanbag genetics model, if you would, where you had a different number of loci having the same effect, having additive effects, and acting independently. Now, the data set we were working with, that previous equation assumed that the genome was saturated. We had a large number of markers so that we can say that any causal locus in the genome is perfectly linked to a marker. In our case, that wasn't the case. We had a pretty sparse genome in many cases. So we modified this and we found that, well, if you add R squared, which is a measure of linkage disequilibrium or the correlation between adjacent markers, then that's the expected prediction accuracy. And as we would expect, as linkage disequilibrium decreases, meaning R squared decreases, then the prediction accuracy should also be lower. And then when we plotted, what we have here on the y-axis is the observed prediction accuracy. On the x-axis here is the predicted prediction accuracy based on the Detweiler formula, and the predicted prediction accuracy when we account for the unsaturated genome. Before I go into that, again, the premise is that a breeder would like to know, if possible, before conducting the experiment, if I know the population size, if I know the number of markers, if I know the heritability, can I predict in advance whether genome-wide selection would be effective? That's the premise here. And so if we can predict in advance if genome-wide selection would be effective, then we would have a perfectly straight line. And we see here that with a Detweiler et al. Formula, this line over here is the unity line, slope, it's 1. And so we have an overestimation of the prediction accuracy when we apply that previous formula. When we account for linkage disequilibrium, you see that this straight line is quite centered on the mean. And so we would conclude that as far as predicting the prediction accuracy, that this updated formula works well. However, you could see from this cloud of data points that we really cannot predict the prediction accuracy in advance. I mean, there's a linear trend, but it's still a large cloud of data points about this line. So the lesson is that, again, as much as we want to predict the prediction accuracy in advance, we can do only to a limited extent, but not good enough or not as good as we want. Just breaking it down in different traits, this is the correlation between the expected prediction accuracy and the observed prediction accuracy. From the formula that we modified formula we have, we see that it differs among different traits. And here, if we simplify things a bit and do not try to model the effective number of chromosome segments and predict it just based on linkage disequilibrium, population size, and heritability. For some traits, yes, they behave, we can predict, I think, fairly well the prediction accuracy, but not for other traits. And by the way, if you're working on maize, you would know that lodging, root and stalk lodging, is just a hard trait to deal with. Okay? Second lesson we've found is that I think we should be using phenotypic genome-wide selection mainly in those aspects of a breeding program when phenotypic selection is ineffective. Stated in a different way, we want to create our training model when heritability is high, and we want to use that in selection when heritability is low. And you'd say, well, that's an oxymoron there. You're wanting both. You want high heritability to create your training population, and you want to apply it in a low heritability situation. Well, there are some ways to accomplish that. For example, if you are selecting for disease resistance, then you could create your training model for disease resistance under ideal conditions, and then you apply your selection when the pathogen is absent. If you apply selection when the pathogen is absent, there's no genetic variation that is expressed. Heritability is effectively zero. You could do that in a greenhouse environment, for example, and then have your genetic gains that way. And what we have done in maize is this idea of shuttle breeding, in that we have our yield trials in the U.S. Corn Belt in the summer, and then we can send our plants to Hawaii. And if you're in Minnesota, going to Hawaii is nice. Send the plants to Hawaii for multiple generations of selection based on genome-wide markers. So the idea here is that phenotypic performance in Hawaii is not indicative at all of phenotypic performance in the Corn Belt, but the markers stay the same, whether you grow the plants and extract the DNA in Hawaii or in the Corn Belt. And because you could stack several generations, you then increase your gain per unit time that way. And we've found from an empirical experiment that that system actually works. This was an experiment to use genome-wide selection to select for both grain yield and stover quality traits that are important in producing cellulosic ethanol. The idea was to breed corn so that we could use the grain for its usual purposes and not have fuel needs compete with food needs, so you could have your corn and eat it too. And so what we have here is cycle 0 to cycle 1 was phenotypic selection, and the length of the x-axis indicates the amount of time needed to achieve that gain. So we get positive gains from phenotypic selection. Here it's for selection for yield traits and stover quality traits, a total of 7 traits, and this is on the top is selection for a stover quality index of 3 traits. So phenotypic selection is effective. The top lines are selection based on all the markers. Remember that in genome-wide selection, we do not do significance testing. We select for all the markers simultaneously, whereas the bottom line is selection based on significant markers only. And we found that, as we expected, we have larger gains from selection when we select on a genome-wide marker basis as opposed to selection based only on those markers that have significant effects. We used near-infrared reflectance spectroscopy to do stover quality analysis, but we also evaluated our responses based on actual wet chemistry tests, and we found that even though genome-wide selection was still effective, we actually had negative gains towards the end. And we attribute that to the fact that NIR, it's based on calibrations and in a certain biomass characteristics. However, we are actually attempting to change biomass characteristics, and so when we do change biomass characteristics, those initial NIR calibrations become no longer effective. Breeders like to say you get what you select for. We selected for NIR-based predictions, and we got good gains for those. So it was nice to see from an empirical experiment that genome-wide selection works. We also did a similar experiment, in this case, to breed for, to introgress dwarf corn germplasm into U.S. Corn Belt maize. The idea was that we were thinking perhaps if we make corn plants to be about this tall, we could plant them like we do wheat with about 10-inch spacings and produce more corn that way. So that was the idea. We found the black black lines are the open lines are the predicted gains for plant height, yield index, grain yield, and so on. The black ones are the observed gains. An asterisk, a star indicates a significant difference. And from the most part, we found that there was a good coincidence between the observed gains and the predicted gains. But also we found that in a way it's a losing proposition. It's very difficult to improve grain yield on plants that are quite short. But we got a grant from it anyway, so that's fine. Now, that was in a recurrent selection scheme. Now, in most of maize breeding, it's not a recurrent selection scheme, but it's more a straight line development. And this is hybrid breeding in a nutshell. You cross a homozygous line A with a homozygous line B, and then you could induce doubled haploids to get instant inbreds. You evaluate them for test cross performance, and then you select your new inbreds based on test crosses. And a place to do genome-wide selection is among F2 plants. And why that works is that selection for yield, there's an auto here, I don't know why that is. Selection for hybrid yield among F2 plants is known to be ineffective. Selection for hybrid yield among F2 plants is known to be ineffective. And so this is a place where gains from phenotypic selection are 0 or near 0. So this is a place to get some good response. And so we found, we said, okay, if we want to predict the performance of A by B, we would argue the best training population for A by B is a subset of A by B itself. Meaning that if we have 150 lines, we could genotype and phenotype a subset of that, phenotype a genotype, the other subset, and then predict within the same cross. Now, we also argued that perhaps a good training population is a cross between two lines, star by star. I'm an old Microsoft DOS guy, and those of you who grew up on DOS know what star means. And so star is any line related to A and B, okay, a related line. We figured, though, that perhaps an even better population is if we go back to our data and find all our previous populations that had A as one parent and B as one parent, we can pool all of these together as our training population to predict A by B. And the nice thing here is we know that the allele in the training population is exactly the same allele in the test population. And again, the idea is simply to use prior data. The disadvantage with the AB is you need to phenotype AB itself. Here we're wanting to see, can we use historical data to predict the performance of new crosses? And so we call this the A by B method, GCA for general combining ability, and SB, the same background method. And we found some details. We studied a total of 30 populations. The number of training populations that are pooled ranged from 4 to 38, and there were from 650 to nearly 6,000 individuals in the training population. To keep things simple, we used the same line as the tester for the different crosses. And here's what we found. These are not correlations. These are responses to selection. These are the responses to selection from the different schemes. We found that phenotypic selection on average led to a gain of 0.25 megagrams per hectare. That's 4 bushels per acre. That's phenotypic selection. Now, if we do genome-wide selection under the A by B model, meaning we use that same cross to predict a subset of the other cross, the gain was about 0.18 tons per hectare, so less than with phenotypic selection. Again, the disadvantage with A by B, well, you need to phenotype the cross itself. With a GCA model, the average gain was 0.19, so not as good as phenotypic selection, but again, it's a significant gain. And we see here, though, that if we do not select the training population so that it is closely related to what we're predicting, and we pool random inbreds from the same heterotic grouping, from the same background model, the gain was only 0.07, quite less than what we get from the GCA model. And we said, well, what happens if we actually pool these two so that we double the size of the population? What do we get? Well, we see that the correlations really did not increase. In fact, on average, they were slightly less than the GCA model, which means that you come to a certain point. Well, the relatedness between the training population and the test population is really important, and it, in a way, trumps population size. It trumps population size, and that is a key. And so, if we take a look back, what we're saying here is that just based on SNP data and prior information, we can gain. We can select among F2 plants for yield in maize, and the gains we get from that procedure are about 70% of the gains that we eventually get from phenotypic selection. And I think that's significant progress. Now, another aspect of the work we're getting into is trying to predict the distribution within a cross, meaning that before we make the cross, can we actually try to determine what that cross might look like? Because now you have real markers, you have real phenotypic data. We can see how that cross might segregate and predict the distribution of the cross. I won't go into that in detail, but this is the type of data we get. This is the genetic variance in the cross, and if I zoom down on protein, this is the mean of the cross, and this is the expected variance in the cross, and you have this sort of triangular relationship. And you see then that different crosses have different means and different expected variances. We're doing different, we're planning to do experiments to test this idea further. All right, so if we have information on known genes, I gave that slide earlier. That's a bit of too much of a simplification, because we could have a trait that actually has a few known major genes and many unknown minor genes. And I found that, well, we could include that in our prediction model. This is the relative efficiency of genome-wide selection. The basic idea is simply to give a fixed effect for that marker. If I have 384 markers and marker 1 is for a major gene, for marker 1 we treat that as a fixed effect. For markers 2 to 384 we simply treat that as having a random effect. And here the percentages indicate the efficiency of doing that. Meaning that this is a different size of the population. R squared is the effect of the major gene. So we have a major gene accounting for 50% of the variation, and the heritability for the background heritability. If we have a major gene with a large effect, we gain 12% more gain by giving special treatment to that known gene, as opposed to ignoring the causality of that known major gene. We found, though, that heritability trumps things, and that, well, if heritability decreases, it doesn't really matter if we give special treatment to that known major gene or not. So some rules are, if we have a trait when there are few major genes present and each major gene has an R squared of 10%, then yes, we think go ahead and incorporate such information in the model. Fourth point is not to worry too much about prediction accuracy. We know that heritability is a measure of the effectiveness of phenotypic selection. We know that we increase heritability by increasing the genetic variance, increasing the number of replications, increasing the error control. We know heritability differs among traits, but we're okay with not being able to predict it. We actually don't try to predict heritability in advance. The same for prediction accuracy. We know the factors that increase it. We can't exactly predict it in advance, but so we're in the same boat as with phenotypic selection. Sometimes it works, sometimes it doesn't. But if you do it consistently and as well as you could, it should work well. So the main points is that, again, it often works, but sometimes doesn't. We should use it when phenotypic selection is ineffective. We can incorporate information on major genes and not to worry too much about prediction accuracy. Let me close with a philosophical comment. Well, not yet. So my take based on talking with corn breeders, the ones in green are the bandwagons that I think have stayed and have shown lasting power and have been shown to be quite effective. interesting thing is that early testing was once in green, and haploidy was once in black. And doubled haploids came along, and the technology came along for doubled haploids to be effective, and now the two are switched. And it's interesting to see years from now if any of these would change from black to green based on how the technology develops. Now, I've thought a lot about, I had a car engineer friend, of how a car engineer designs a better car. The car engineer understands how each part works, how each part interacts with other parts, and uses that information in the design approach to build a better car. Now, if a breeder, a plant breeder, were to design a car the way he or she breeds plants, here's what the breeder would do. You would get two cars, high performance, a Porsche and a Ferrari, okay? You would create thousands of cars that have interchanged parts, and you select the best shuffled car, and you do it again and again and again. So here you have your design approach. This is more of your empirical or predictive approach. And the nice thing with molecular markers is that for some traits in plants, we can do some of this already. But for more complex traits, we're still on this mode here on the right. It's interesting to see in the future if and how that changes. And so with that, I thank you for your attention, and I don't know if there's time for questions or not. Thank you.
Thanks, Rex. That was really exciting talk. So yeah, there is time for questions.
So one of the things you talked about, and people doing this kind of stuff do this, they assume their genes are additive, they act independent, no epistasis. Yet when we think about things biologically and physiologically, biochemically, it's never like that. So how valid is it to think of genes acting, empirically, how often does that hold up? These underlying assumptions, or
Well,
have any validity at all?
So the question has to do with the validity of the assumptions that we commonly make in quantitative genetics. And so ideally, the ideal situation is to approach it without any preconceived model at all, right? Say, okay, I have no model, I have no preconceived notions, but the problem there is, well, where do you start? And it's just an infinite number of solutions. And even if we think of mapping major genes, we actually impose a model when we map major genes. We impose a linear model, and we are detecting major genes in a way that fit this preconceived model that we have. I mean, why do they have to act additively? Why not multiplicatively? Well, why multiplicatively? Why not exponentially? And so the thing, though, is, well, to have something that is tractable and workable, we need to start with something, and then we start with a simple model. And then the danger, though, is that we start with a simple model, and we keep going, and in our mind we're convinced, well, this is the actual model, and we fail to see what the ramifications are of something that is more biologically meaningful. The point, though, that has been brought up, well, if your purpose is more to select the best candidates, and you're using markers simply as a tool for prediction, in a way, whether it's biologically meaningful or not is secondary. However, if your objective is in using markers to determine genetic causality and to gain biological information, then that would have to be a different mindset.
You had a couple of interesting observations in the correlation. One of the early tables you showed, where there are three groups of traits. The n numbers seem to go, or the validity seem to go with the n number in the top half. And then you had a trait which is height, which, if I remember right, is polygenic.
Okay.
So that indicates, would that indicate
I'm-
that more the number of genes,
Yeah.
higher the predictability?
Yeah, I'm sorry, I didn't explain that well, that n is not the population size or the number of genes, it's a number of populations. So there were nearly 10,000 populations, but say height was not examined at all. So I'm sorry, I forgot to describe that, but that's what was going on. Yeah.
Rex, you highlighted in green the QTL mapping. Are you talking about linkage analysis or GWA, gene
So in the bandwagons, I had QTL mapping in green, and you're very observant, association mapping was in black, right? And I put association mapping in black because in plant breeding, what we're often after in plant breeding when we do QTL mapping is to find major genes that are currently rare in the population. And we recall that in genome-wide association mapping, that finds mainly those common variants that are common in the population. And in fact, if a variant, let's say I have a panel of 1,000 maize inbreds, 999 are susceptible, and one is my rare resistant one. Well, if I do an association mapping analysis, I probably will not detect that one as having a significant effect. In fact, I might exclude that from my analysis because the minor allele frequency is too rare. And so from that context, I believe that association mapping in plant breeding is less useful, again, because in plant breeding we often try to find rare variation. However, if I have my rare resistant line and I cross it to a susceptible line, then my allele frequency is now 0.5, and I can detect markers linked to that trait. And so, again, it's that type of thing where a new thing comes along, association mapping. I mean, if it's association mapping for candidate genes, such as the glutenin genes in wheat that we know affect quality, I mean, that's great. But if it's in the context of breeding for types of resistances that are currently rare, then I would argue that QTL mapping is more useful.
Time for last question.
All right, I'll ask you.
You were the advisor.
More senior. Okay. So those cases where you show the different populations where you had some outliers that severely underperformed, they could serve as good models to try to understand what's going on, right? Were there genotyping errors in those populations? Were there phenotyping errors? Was the data mixed up? Did you guys look into more detail into some of those populations to try to define what's wrong?
So the question is, in the populations where the correlation between the observed and prediction accuracy was low, did we focus to try to see what the causes for that low correlation might be? Well, this is data from Monsanto, so they're reliable. Phenotypic data, marker data, we would say would be reliable. But what we did was we looked at to see these populations that have low, that are not predictable. Were they the same for each trait or different for the different traits? Because if the same population was not tractable for yield, moisture, lodging, and all the different traits, then we say, well, there could be a big error there, and that was not the case. That the populations that tended to be unpredictable for one trait were not the same as for the other trait. Thank you.
So today we have been talking about human geneticists, animal breeding, maize breeding, or annual, and now is the time to talk about perennial breeding. So in this specific case, in the case of pine breeding, or eucalyptus and so on, which is where it's expected that genomic selection or genome-wide prediction actually might have the greatest impact due to the large generation cycle that might take years. So today we have Marcio Resende, actually one of the co-founders of this workshop last year. Marcio obtained his BS in the University of Viçosa, Federal Viçosa in Brazil, and also his master in genetics and breeding in the same university. He moves then to the University of Florida, where he obtains his PhD in genetics and genomics, in the genetics and genomic program, actually. And after that, he graduated actually last year, and now is the vice president of the Rapid Genomic company that deals with genotyping and prediction using this genomic data. So, Marcio, very welcome too.
Thanks, Patrício. Thanks, Matias. All right, good morning, everyone. So I'll talk today a little bit about including non-additive effects in the prediction of complex traits. I'll focus mainly on dominance effects. I won't attempt to predict the effect of each marker whenever interacting with another one. And the main reason for that is because with the number of observations and population size we have nowadays, these kind of models, they become pretty complex when you consider all possible interactions and all possible ways markers could be interacting. The number of parameters you now have to predict increase. And I will touch briefly in epistasis in some of the results we got from it, but not specifically as predicting the marker effect of it. And because we have such a broad range of interests here, I thought about just briefly talking a little bit about the species we work as a model, which are basically pine trees. So pine trees are pretty common in the northern hemisphere, and they're also planted in the southern hemisphere as well. Genome size is about 7 times larger than the human genome, sometimes even more than that. And it's a commercially important tree. It's basically plantations of pine here in the southeastern U.S., and especially loblolly pine, which is the species that I will be focusing today. They provide about, well, in 2002 at least, they used to provide about 15% of the world's timber. So it is an important tree. Traits that are typically evaluated in the breeding program are yield traits, which in the case of trees are basically total height and diameter at breast height, disease resistance, and more recently wood quality traits such as lignin content, cellulose content, and others. Now, one of the big challenges of pine breeding, and which is actually interesting to mention right after a maize talk, which is the fact that the breeding cycle is exceptionally long. It may take up to 20 years to actually get one entire generation. And UF breeding program for loblolly pine started in 1950, and we are right now in the 3rd or 4th generation, which is probably what Rex gets in 1 year of his program. Now, there has certainly been advance in research in the propagation techniques to reduce this time and basically bring down the total cycle to basically shorter lengths. But the idea that we can now predict complex phenotypes that express at late ages, that before we had to wait, say, about 6 years to test them and to evaluate if the plants were actually the higher or the superior phenotypes. The idea that we can now predict them with genomic selection would dramatically shorten the cycle interval. So you should expect that genetic gain per unit of time there would be highly increased using genomic selection. So the population we have available here at University of Florida was established long before I came, a little over 10 years now. And it's called C-clones, which stands for Comparing Clonal Lines on Experimental Sites. And what it is basically a set, it's a breeding population that consists of 61 families. These 61 families come from 32 different parents that were crossed in a specific mating design, and they were clonally replicated in several populations across the southeastern U.S. This population was phenotyped for a variety of different phenotypes, including the ones I just mentioned, height, tree height, yield, and disease resistance, and others. And it was also genotyped about 1,000 different genotypes were genotyped to have about 3 SNPs per centromere organ. And this is basically the collection of data set that we have available. This population was used throughout the years for several different research projects. Genetic gains and genetic parameters were estimated for multiple different traits. We looked at disease, well, people here at UF looked at disease resistance and association methods. And our particular interest is to evaluate the ability to use genomic selection and what would be the predicted gain in incorporating these techniques into pine breeding. So I guess just like the previous speakers today, the goal that we have is basically to predict complex phenotypes based on a set of marker data. And the way we did this, similarly to what was also mentioned earlier today, was in the cross-validation approach. We have our population of about 1,000 individuals. A large subset of these was treated as an estimation population, is where our model was fit. And the remainder subset is treated as a validation population. We fit our model, and we predict, based on our model, what would be the predicted phenotype or the predicted breeding value on that validation set. And we correlate to see how well the observed, given that we do have this observation, matches with the predicted. And we basically run this for 10 times. In that case, it was a 10-fold cross-validation, and we evaluate how well we can apply this to breeding. So obviously, in the case of trees, it's a lot harder to evaluate a real-life situation, which is you would predict your model in one generation, go to the next generation, and evaluate how well that actually predicts phenotype. You probably have to wait a few years to take these plants to the field, wait till they grow, see if they actually are the top ones that you predicted them to be, to see if your model is working well. So this is basically what we have available in the system to evaluate. And when we looked at that, for now, as an additive model only, when we looked at it in 4 different sites, which are named BF Grant, Cuthbert, Nassau, and Palatka, and I'm showing here 2 different traits, diameter of breast height and total height, you obtain accuracies that range from 0.62 to 0.76. And to have an idea of what these values they actually mean, we compare to the accuracies of the phenotypic blob, or what would you actually gain if you were just doing traditional breeding. The accuracies of traditional breeding are not 100%. You cannot predict your breeding value with 100% accuracy. And therefore, that was a benchmark for comparison. However, given the possibility of reducing the cycle interval, reducing the time it takes for the breeding program, we added an additional factor, which is the predicted gain per unit of time. So to have an idea, if we basically have the same accuracy using marker data and compared to phenotypic data, genomic selection will be better because we'll be able to move ahead to the next phase earlier, and then genetic gain per unit of time will be superior. So what we looked is basically that for some cases, the accuracies of genomic selection were higher than the accuracies of phenotypic selection. That was not always the case. But overall, whenever you assume what's the efficiency per unit of time, it was always better, and it was always justified doing further research to evaluate the feasibility. So where we are right now as far as additive models is basically now discussing how can this be validated efficiently in a real-life situation, which is basically taking some of these families to the field, wait till they grow and see if they actually behave better as predicted. And how to incorporate that to the breeding program. What needs to be adjusted if you now have a prediction model? How often are we going to introgress new materials? Because every time you introgress an unrelated individual, your model will likely not account for it. So that's basically the further steps as far as the additive. But in parallel to that, and that's basically what I'm going to focus my talk today, we wanted to evaluate what would be the advantages, what would be like to incorporate dominance, especially into genomic selection models. So I'll basically talk a little bit about genomic selection models, including dominance, and evaluating in the sequence population. I'll show you that we did have some unexpected results, and the ordering of how the research happened here is swapped a little bit. This is actually the latest result I got last week, but I'm presenting it first because I believe some of the results we've been getting from last year may answer some of this, as you guys will see. And assuming that dominance is indeed real and we are actually able to estimate it, one natural application of it would be to allocate what crosses to be made instead of what individuals to be selected. Can we identify crosses that whenever combined, they present a hybrid vigor or an actual dominance combination, specific combining, that will basically be better for your breeding? So those are the three areas I want to focus. The first topic here, including dominance, is basically part of the work of three PhD students here at UF, Jânio Almeida, João Felipe Guimarães, and Rodrigo Santos. And they basically just generated this data last week. We're trying to get something here to look at it. And why we want to look at non-additive effects. Why is that important? There's a school of thought in quantitative genetics is that we may just be able to care for additive effects. The additive models may capture all the genetic variants. And on the other hand, like echoing what Kurt Hanna just said, we have phenotypic evidence for dominance, if you will. We observe in the field hybrid vigor. We observe in breeding depression. In control pollination families, we observe that the family performance is better than the parents. We have molecular evidence. We know that genes interact. And just by looking at a pathway, we can expect everything to be connected. And the problem is if we are estimating the additive variance, and if it's indeed capturing all the genetic variants, that will not be transferred, or a portion of it may not be transferred to the next generations of your breeding, and you could overestimate your gains, you could overestimate your heritability. So there could be potential problems with that. The other side of it is that if you now can predict dominance using marker data, you could expectedly direct your crosses to exploit that even in sexual propagation. If you can now predict how to create dominance in the next generation, you become able to use that in your breeding. So with that, what we wanted to compare was how well can we perform in a genomic selection model using only additive effects, as it was shown by exemplified by Guilherme, and what results would we basically get whenever adding a dominance component to it, and that's simply adding a weight to your marker only whenever the genotype is heterozygous, and fitting that as a linear regression for different models and observing the prediction accuracies in a cross-validation. So at this point, the hyperparameter specifications, we use this BGLR package from Gustavo de los Campos and Paulino Perez, and we are evaluating different priors, but at this point we use the standard from the program, which are not very informative priors, and we thought that would be a good way to start with. But when we look at the correlation between genomic breeding values, or basically what you predict using your markers, with the phenotype, and just an aside, that's why these numbers are slightly lower than the ones I showed you a few slides ago, because that's prediction ability compared to the phenotype and not compared to the breeding value. We observed some interesting results here. To start with the fact that, and what I have in the rows, the additive with a star is the model having with only additive effects, is the traditional genomic selection model that we typically are used to run. And the next three rows, I basically have what was the correlation between my estimate of the additive effect in the dominance model. What was the correlation of my estimate of dominance effect in the dominance model? And whenever I sum them both, what was the estimate of the genotypic effect with the phenotype? So there's some points that are interesting here in that overall, and we observed for different traits and different environments that happen in all the cases, and there's actually some reports in other species where this was also the case, the additive accuracies decreased a little bit. So you're now predicting a little less, although not very much, but than what you were before. More than that, we were able to obtain fairly decent values for the accuracy between additive and dominant of additive and dominance, and one would expect that Well, if phenotype is a factor of additive dominance, epistasis, and plus other effects, whenever I correlate my additive components with the phenotype, I would expect that to be somewhat equivalent to a correlation of my predicted breeding value with the true breeding value. Whenever I correlate my dominance components, if I assume everything is independent as it's typically treated in quantitative genetics, I would expect the correlation of my dominance with the phenotype to be equivalent to the estimated D with the real dominance. So we were hoping that if you now sum them both and you get a genotypic value, this should be able to predict a little better or have a higher correlation with the phenotype, which was not typically the case, or at least it was not an additive thing in the sense that the genotypic correlation was very close to the additive accuracy that we got from the additive model. So that's when I now moved to a different point that in parallel to all this research, Patricia and I were looking at this same data. Well, it's a different environment, but it's similar data from a different perspective, which is, can we partition additive and non-additive effects using genomic relationship matrix? Can we basically get phenotypic data, go to the field, get phenotypic data, and distinguish what's additive and what's non-additive using genomic relationship matrix? Well, just a brief one slide about relationship matrix. They're pretty standard in animal models, in mixed models for animal breeding and some plant breeding as well. And it's basically, whenever you rely on the pedigree, it's basically on what's the expectation you have that two individuals will be related, will be sharing genetic components to it. So for example, two full sibs are expected to share 50% of an additive component and 25% of the dominance relationship given the pedigree. Now we're able to, and that's based on identity by descent. We're now looking at the data for markers. We're able to get an estimate of what's the identity by state, or if you will, what's the expected relationship given the data that you have. So two individuals, they're completely unrelated. Based on the pedigree, they're unrelated. So the best you can do is to say, well, the pedigree relationship is 0. Well, it may be that by chance they share 10% of the alleles you have genotyped, and that's an extra information that you can use in your model to partition the variance. So I won't go into the details on how we generated that, but we generated the relationship matrix just using standard formulas that were already presented in the literature and expanding the Van Reyden relationship matrix into a dominance partition where you're now parametrizing your markers as 0, 1, and 0. But the main idea of this study was to compare the estimation of genetic variances by using relationships constructed from the SNPs or from the pedigree, and to evaluate what partition can we get out of it. So just to give you a feeling for how this data actually looks like, I plotted in the x-axis for additive and dominance the classes of the pedigree matrix that I have based on my pedigree data. And in the y-axis is the observed relationship matrix based on the markers. So you can observe, for example, that this class, which is 0.5, and it stands for the full sib, all the full sib individuals, whenever we look at the marker, we get a distribution that is somewhat centered in the expected value, but with a range of values, and that's due to Mendelian segregation. Now, the implication of that in dominance is that whenever you have relationships that are half sib or lower in the degree of relationship, there is nothing you can predict as far as IBD. So basically, the dominance relationship for a half sib is 0 because you can't tell how much of that is being shared based on dominance. But you would expect the IBS to be a little higher because they are sharing in one parent, which we actually do see in here. So the class of 0 from the pedigree, based on the pedigree, all we can say is that those individuals are not related on the dominance component, and we see a large variance with a lot of higher values, and these values can be used now to extract a better information from the variance components. So with that in mind, we fitted a random mix model that has some environmental effects, random and fixed, but most importantly, it has an additive component to it, a dominance component, and an epistasis. And in each case, the additive, dominance, and epistasis effect of the individual, we're not really talking about the marker effect. This is how much of the individual is due to the additive effect or dominance effect. They are associated with variance-covariance matrix that are the relationships. So basically, you're using the relationship due to additive or dominance to estimate the additive or dominance effect. And the only thing we wanted to compare was what results do we get when we replace the models that are traditionally used with pedigree matrix, we now replace it by marker data. So as an example, model 1, I only had additive effect, therefore D and I were not in there. The matrix that I used to estimate this covariance was the pedigree, and that's why I have a P here from the additive, and I only replaced that matrix by matrix of same dimensions, although a little less sparse, that comes from the marker data. Similarly, we increase the level complexity, and we now have pedigree models with additive and dominance, and marker models with additive and dominance. And pedigree models with additive dominance and an additive by additive component that's expected to extract some of the epistasis, and so on. And we wanted to basically see what variance partitioning do we get out of that, and whether or not we can improve the predictions based on that. When we looked at the pedigree-based models, what I'm showing here is the proportion of the genetic variance that's explained by additive, narrow sense heritability, dominance, and epistasis. And the conclusion that we looked was that even when the model complexity increases, the partition is the same with pedigree. These estimates of dominance were not significant, and therefore the overall practical conclusion is, yes, non-additive effect would not be important here. We can just move on with our additive models and carry on the breeding as usual. Whenever we fit the exact same model but replacing the pedigree matrix by the marker-based matrix, we obtain drastically different partitions where now the model that had additive and dominance, a much higher proportion was actually expected to be due to dominance. And whenever you add epistasis to it, the variance proportion that's due to epistasis also went up. So what we hypothesized for that is that, well, we observed certainly a different genetic architecture, and what we hypothesized for that is that the pedigree models could be confounding all the genetic information into one component that's additive, and therefore your additive model is capturing all your genetic information. And I'll show some evidence for why we think this is the case. We tested basically, like Guilherme mentioned, the model fit. How good was each model, and what was the fit of it? Indeed, the two best models were the marker-based with epistasis information, but they're not better by far. They were not much better. And again, that would one way that you could think that would support the hypothesis that if indeed your model that has only additive effects is capturing all of your genetic information, not adding to your model dominance or epistasis wouldn't affect much the fit of your model. However, what's the practical application of that? Well, you may be overestimating additive, and you may be overestimating your gains, and you may be overestimating your heritability, which was actually observed here. The narrow sense heritability in the additive model, both marker and pedigree, was decreased for about 26 and 43% whenever you increase the complexity in this population for this trait. And based on the model fit only, we were not able to fully distinguish or fully conclude which models were better, and we decided to explore a little further what was the correlation of the variance components, or in other words, how additive, dominance, epistasis, and the residual term were correlated. So the way to think of that is we looked at the asymptotic variance-covariance matrix of the estimates of the variance components. And if you think of a matrix where your model is fully orthogonal, so additive is independent from dominance and independent from epistasis and the error, the correlation matrix would be 1 in the diagonals. Of course, additive is correlated with additive, dominance with dominance, and 0 in the off diagonals. Nothing else is correlated. If you plot basically the cumulative proportion of the variance explained as a function of the eigenvalue of these matrix, you get a fully orthogonal line where each eigenvalue explaining equal amounts of variance. When we looked at the pedigree model, that was by far not the case, and the conclusion here that we actually come to is that the marker-based model may be less correlated or may be able to partition better the genetic information, and therefore you may get more accurate and more estimates, more accurate estimates of what's due to additive and what's due to dominance. So fine, if that's the case, we should expect predictive ability to increase, right? And that's what we looked at. What was the model predictive ability as the correlation of each term with the phenotype? And what we observed is that the breeding value, whenever correlating the breeding value with the phenotype, in the model, in the most complex models coming from the markers, was actually lower than the correlation of the pedigree model with the phenotype. Well, does that make sense? It does if you assume that your pedigree model is actually capturing all the genetic variation. So whenever you correlate what you think is the breeding additive effect or breeding value with the phenotype, you would get basically the same thing you would whenever you correlate with all your information. That's actually the case. Whenever we correlated the genetic value, both pedigree and markers predicted exactly the same. So basically the hypothesis is that if the additive effect is capturing a large proportion of the genetic variance, it may be capturing actually a large proportion of both dominance and epistasis variance. And the genetic architecture may in fact in this case be different than what we thought it was. So I'm just showing here the same data as the correlation between the breeding value with the phenotype, and whenever models that we have actually more than one component, you sum them up and you correlate it with the phenotype, you observe that additive models, they get about 0.9 correlation. This is the correlation with the average of all the ramets, so that's why these values are high. But the correlation between the breeding value with the phenotype was higher in the model of additive only based on pedigree. However, whenever you added the dominance component that was estimated based on the markers, you obtained the same result. Now, the hypothesis, you may think of this as fine, the pedigree model is working just as fine, or you may look at that and say, maybe we're overestimating this, and not all of this will actually be transferred to the next generations and will be actually explored in our breeding program. And I'll skip to that. So just in summary, we believe that with this data, we think that in this population, in this data, in this trait, additive and non-additive effects may be confounded whenever estimated based on the pedigree. We think that marker-derived relationship matrix produced a better partition of the genetic variability into additive and non-additive effects. And basically the practical applications of that is that, additive effects may be overestimated. You may overestimate breeding strategy and then genetic gains. And if this is the case, you actually are may be getting a better understanding of what's the genetic architecture of the trait using marker data. So if now dominance or non-additive effects, and I'll focus specifically on dominance, is actually present and we may be able to estimate the effects, we can think of a situation where we can predict the crosses. We can use that information to predict what are the best crosses to be carried over to your next cycle. And if you think about C-clones specifically, there are 950 individuals in this population. There are virtually 450,000 possible crosses. So it's certainly impossible to do that. in the field. Now, what if we can use your genomic information to predict what are the crosses that should be taken to the next generation? One way to do that is to imagine the cross between a given individual 1 and individual 2 may generate a variation in the progeny, a variability in the progeny with a mean 2, that's higher than the progeny mean of the different cross. Therefore, whenever you apply a certain truncation selection point, you're going to increase your chance of getting an individual in that past that point. Now, if you're only caring for, if all you have is additive, the progeny mean is simply the mid-parental average. You just average the breeding value of the 2 parents, and you get the progeny mean. If now dominance is present, it's not the case because the progeny mean is affected by how the two alleles are interacting. So what we wanted to do is to see how well we could predict that. In other words, if I have basically a number or estimate for an individual that the breeding value of that individual is 50, the breeding value of another individual is 70, I can predict, if everything is additive, I can predict that the mid-parental average will be 60, the progeny will be 60. Now, if I now know that they have a dominance value of 25 and a dominance value of 5, I don't know how those will combine and how those will interact in the progeny. However, if I have an estimate of the dominance effect of the marker, I can basically create situations where this cross, whenever crossed for this specific loci AB with AA, 50% of the progeny will express that dominance effect. Therefore, I may prefer to choose a cross where for this specific loci, all my individuals will be in heterozygosis, and therefore that extra dominance effect that I had predicted to exist will increase. We did that in C-clones for all the markers, and that's basically just calculating the probability that given a father genotype and a mother genotype, what's the probability that the progeny will be big A, little a, or A, little a. And what we observed as far as rank correlation, or how well the two predictions using mid-parental average or using A plus D, they differ in, well, the rank correlation between both is 0.82. So yes, they're similar, but if this is actually real, there is room for improvement. Now, we won't be able to validate that in C-clones until we have data in the progeny to see if actually the progeny prediction coming out of the markers is actually better. So instead, and this I'm basically just showing some data where these 2 crosses, and this is the predicted distribution for 2 crosses, these 2 crosses based on phenotypic data, they were predicted to have the same mean. However, given the combination of alleles that expressed using genomic selection, this cross was actually predicted to be much better, and it shifted from here to here. Now, we won't be able to validate this in C-clones just because those are trees, and they'll take quite some time to go to the field. We won't be able to do it now. So what we did was just a simulation study to evaluate whether or not this would be feasible. And I simulated 12 chromosomes, 10,000 biallelic SNPs, quantitative trait of 1,500 QTLs. From these QTLs, I had additive and dominance effects sample from a normal distribution. And basically, 1,000 founders were generated and randomly recombined for 1,000 generations. So that's the base population, LD very low. I basically applied on generation 1,000, 10 cycles of mass selection to get to generation 10,010. And on generation 10,010, I basically have a set of 1,000 individuals. I can go to the phenotype and select the best ones, simulate one more generation and see what's the progeny mean. I can do the genomic selection on the same generation, take one level further and see what's the realized progeny mean, and use actually mate pair location. So basically, we selected the parents based on each of the methods, phenotypic blob, mass selection, and mate pair location, and simulated one new generation 1011, and calculated the progeny medium to see actually how well we were selecting the best individuals. So what we observed, and this is the unit is actually relative to the phenotype that was generated, but the important thing here is that the 4 methods that performed the best were actually different genomic selection methods that were generating mate pair location predictions. Now obviously I made sure that these simulations all had dominance effects, so I was probably creating the best case scenario, but that was exactly the idea, to see how well we could predict the progeny given the genomic data. So I'll skip into that too, because I think I'm running out of time. But I want to move then to the next steps, what we're actually working on right now that we believe that dominance may be present, we may be able to estimate dominance and combine these into predicting the crosses. And that's actually similar to what Rex Bernardo mentioned in his previous talk, is can we predict the progeny distribution given a cross? So as an example, we may have 2 different crosses that they generate the same mean progeny value. However, one has a larger variance, and therefore for breeding you would be better because you have a higher chance of finding individuals in a certain truncation point. For seed deployment, it may be that this cross is better because it's more homogeneous or is more similar. So the idea is, if you now have a genetic map, you have different SNPs scattered for that. Using your genomic selection methods, you have an estimate of what's the additive component and the dominance component of each SNP, and what's the expected recombination rate between them. Basically, you could simulate different meioses and different recombinations for each cross and see basically what would be the distribution of the progeny given each cross. So we started looking into that. That's data on C clones where these two crosses, this is the distribution of 2 different crosses, and you can see a completely different distribution. Certainly it is a function of heterozygosity, but now it's a heterozygosity weighted by the estimates of dominance components in each locus, and that's something that we're currently working on. So just some conclusions. I believe that genomic selection can and I think it probably will be used to select not only the best individuals but also the best crosses, especially in plant breeding. I think mate pair location allows a better exploration of non-additive effects in breeding, and that's what I mentioned by, I even think it's somewhat of a paradigm shift, that you're now able to explore non-additive effects in a sexual propagation breeding scheme. Yes, they're not going to be inherited, but you can plan a certain cross that will carry dominance effects to the further generation. So I think further developments towards the identification of crosses that are also stable across environments may or not be interested depending on the strategy of the breeding. And I think non-additive effects will be perhaps even more important in polyploids or autopolyploids, and that's some work that Patricio is carrying now, because you now have higher order interactions, so you transfer copies of the heterozygous alleles from one generation to the other. Well, with that, I'll just acknowledge all the collaborators and everyone that was involved with that, and I'll take any questions. Thank you. Isn't it noon? So I guess I ran too much.
So I'll start. So Marcio, and this is a question actually I would like the other speakers to talk about later after Marcio is done. If you have to design, because I mean most of the programs right now, or let's say in another way, most of the people is working with whatever population is available. Now, what about if you have to design a population from scratch? Because now we already are done working with what is available. Now we have to think in the future. I mean, what is the population that we need to design to apply these technologies in our breeding programs, in our species, and the traits that we are working on. So what will be the kind of population that you will design, the ideal population to do genome-wide selection?
I think this will be certainly a topic for discussion in any species, and I think one of the questions that we need to answer is whether we're going to use genomic selection as a tool to the breeding strategies that we already have, or we're going to redesign the breeding program so that can focus mainly on genomic selection. One of the points that I still think that these models, they capture a lot of relationship aside from LD, and therefore, well, your training population will hopefully will have to capture all your diversity from your breeding that at least you want to keep for a few generations. Otherwise, I expect these models to go down faster if you have introgressions every new generation. And I think the population is also very specific to the species. I'm sure the folks in animals, they have a specific, the way it works, it may not allow the definition of effective population size and relationship, but I don't know. You guys want to comment on any of that?
Sort of related to this, in street breeding, obviously the breeding itself is so slow that the time that we have to actually design these new populations is so long that perhaps we're not thinking about that. But I guess one of the questions in animal breeding as well as perhaps in maize breeding, whether if you see the companies and the different institutions that do breeding already changing the way they structure their breeding populations in order to accommodate genomic selection in a more efficient way. Do you see a shift, or is still the breeding is doing the exact same thing, the exact same way they did breeding 20 years ago, and sort of the people doing genomic selection just using the data the way it comes? Guilherme.
They are still, the way they cross the animals is still the same, but the question is which animals to be genotyped or phenotyped. I think that's always have this question. So if phenotype is available on animals, and we need to choose which one genotype. So selecting genotype is a strategy. Sometimes the phenotype is so expensive to explore the animal. Then you have genotypes available, and you need to choose ones that are going to be phenotyped. Then it's a good discussion on which one to use, phenotype or phenotype. So you want to maximize genetic activity of this population, reference population. In simulation, we've seen that the prediction ability increases when you work with extreme animals, like if you are doing selecting genotype, and the genotype true extreme is better than if you genotype only the top animal. That's how we start in very careful. We have this silos, top animal, efficiency companies, and then you have genotype on them only. Then you go to big cattle, sometimes you have phenotype only on the worst animal, those that have bad performance in terms of growth, and then you order them to look at meat fat, so the phenotype on the worst animal. So I see that this is not optimal at all. That is a random sample or would be extreme.
Rex, do you see the ag industry moving towards populations that are specifically designed?
So the question for those online is, have breeding methods drastically changed, or is it basically using the same methods with a new technology now available? And I think it is more the latter. And so there always is an adoption curve. I mean, you're talking about breeders who would resist changing a rating scale from 1 to 5, and you say, now it's 1 to 9. No, we're not going to do that. It's always 1 to 5. And so we can have a resistant bunch. And so the way it's being adopted, I think, is to say, okay, this is the way breeding is done right now. But without really much fundamental change in the breeding program, you can do this extra thing, such as select for yield among F2 plants now. And it doesn't really change the whole scheme drastically. It's just a little add-on. And so I think that's how it starts. And I think it'll need more time to see, okay, once you get comfortable with this procedure, what are other changes that can be done within the breeding program. So I think many of the breeding programs in the corn industry and soybean industry, they are big ships. You know, they're big aircraft carriers that take a long time to turn, and the practical reality is that much of the breeding is still done the same way, but with new tools that are now available.
Is there any other question in the audience? Okay, Marcio, thank you. Thank you. So with that, first I would like to acknowledge all the staff and the speakers. Thanks for coming. The guys were traveling last night. Larissa was right here, so it was same as Marcio. But Rex and Guillermo were traveling last night, and they're leaving right away, actually. So thanks for coming and for sharing your research with us. Thanks to the staff of the Genetics Institute and to the organizing committee. Thanks you guys for coming, and thanks for the people that's streaming online and watching it from different countries. Now we have lunch is on us, so you guys can go and enjoy it outside and maybe interact a little bit with the speakers. Thanks for your attendance.